분리 과정에서 깨지는 현상이 있었습니다. 이런 점을 저희가 특별히 주목하고 지난 4년 동안 엑소좀을 대량 생산할 수 있는 일종의 그 필터링 기술을 개발을 해서 엑소좀 하나하나의 그 품질을 유지할 수 있는 데 성공을 했습니다. 엑소코 바이오가 개발한 그 순수한 엑소좀을 가지고 향후에는 재생 의료나 항암제 분야로 뛰어들 것을 목표로 하고 있습니다. 엑소코 바이오의 비전은 글로벌 엑소좀 바이오텍 기업이 되는 것이고, 엑소코 바이오가 향후 5년간 1,000억 원 정도의 임상이나 신약 개발에 투자를 하려고 하고 있습니다. 그 결과가 성공적이 되면 전 세계 난치성 질환 환자들에게 큰 도움이 될 걸로 예상을 하고 있습니다.
저 이거 해본 적이 없어서 좀 무섭네요. 색깔 무서운데. Hello, everyone. So we're about to start in 3 minutes, so please take your seats. We also have a special request tonight for the, if you are gonna take any pictures, please upload it on Instagram with the hashtag @AES23 if you're gonna upload any pictures tonight from our event. So we're gonna start in 3 more minutes. Also, I want to ask you to please turn off your phones or put it in silent mode. We're waiting for a few more people, but let's get in our seats.
No, I can let Ethan do that part. Yeah, exactly. I don't get up right there first. I like that better.
Realize that we don't actually have to take the cells, we can actually take the exosomes which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing.
So what we found was that these exosome treatment was far better and much more efficient than any other treatment that we've tried before.
And the ASC had such a big improvement in her rosacea and overall in her quality of life. It just rejuvenates the skin so well, better than anything else on the market at the moment.
I even recently had a patient who
We want to ask everyone to please sit down. If you're already inside, please take your seats so we can start. If you're already in the room, please take your seats and put your phones in silent mode, please.
So that is really developing the next generation of exocobio, exosome-based medicines for more severe diseases.
Exocobio was built to help people stay younger and healthy. Exocobio is the global exosome leader, providing hope and a mean for your future.
Exocobio. Our exosomes, your future.
저나 다른 분들이 노화되는 과정에서 많은 질병에 걸리는 것도 삶의 질이 떨어지는 것을 확인할 수 있었습니다. 저는 조병성이라고 합니다. 엑소코바이오 설립자이며 대표자를 맡고 있습니다. 엑소코바이오는 줄기세포 백성에 집중을 하고 있습니다.
It's here? Okay, perfect.
엑소코바이오 개발한 제품은 근본적인 피부는 학명,
If you're already inside of the room, please take your seats so we can get ready. Please sit down slowly. If you're waiting for someone, please text them to hurry up. If you're going to take pictures tonight and upload it on Instagram, please use the hashtag RAES23, RAES23. Unless there's some sign that says don't take pictures, so please. All right, so welcome to the RAES Regenerative Aesthetics Exosome Summit 2023, hosted by Exocobio and BNF. My name is Diego and I'll be your host tonight. I would like to welcome first Ethan Min, he's the CEO of BNF. Please welcome him.
It's kind of dark. Let the light be. Yes, great. Hi, everyone. My name is Ethan Min. I'd like to start it off of recognizing the people who put this event together. Exocobio. There are so many people here from Exocobio that actually put so much effort, including Mr. Joe, Ms. Dohi, and I'd like to give a big round of applause to the Exocobio team. Please. And there are about 26 countries being represented in this room right now. And that's amazing to us. Last year, I believe we have about 18 countries. Huge shout out to all the distributors who are here, all the doctors that came all the way to Korea. Thank you so much for being out here. Let's give us a round of applause to get to. I'd like to briefly share my personal, or Benev's personal journeys along with Exosome came all the way to be here right now. I'm standing in front of you. Exosome is the big topic. Small particle, but it's the next big thing. And that's our slogan for US market for the last 5 years. It's a nanovesicle that contains microRNAs, growth factors, and lipid-generating enzymes that are very, very effective for a skin rejuvenations, anti-inflammations, and so on and so forth. And then you guys probably heard enough of it. And then again, today, a lot of speakers are going to talk about that from the science aspect all the way to the clinical cases. But I just wanted to kind of draw your attentions to the story where the particle size of the exosome is very similar to virus. And we just have experienced a global pandemic and how this tiny virus could be deadly and could be powerful forces to create a lot of damages on our humanity, right? And all of us have a lesson or two from this pandemic, and we overcame, and we're here. For me, there are significant lessons that I learned, and that are very powerful from this pandemic of COVID-19. I'm glad that I'm here standing in front of you guys, obviously. There's a reason why. I'd like to introduce and actually get your attentions to the book called Tipping Point by, I'm sure you guys heard of the, Malcolm Gladwell, right? He talks about a tipping point, and that is a magic moment when idea or trend, social behavior crosses a threshold, tips, and spread like wildfire. And that's the definition he made. And he goes on and basically talks about how he compares the concept of tipping points for pandemic, and also that can happen in businesses and also social phenomenon or movement. That he said that in order to create one contagious movement, you often have to create many small movements first. And that's the part that I'd like to share today that led me, myself, to all the way to be where we are with Exosome. That since 2020, Benev, after we kind of coming out of the pandemic, joined forces together with Exosome and started this small contagious movement. And we did that by pioneering and paving the way for introducing and spreading this exosome concept into the medical aesthetic market. And we wanted to focus on regenerative aesthetics when we were actually starting doing so. Attending 80 different congresses every year between two companies, when there was no concept or no one was talking about it. Bringing the speakers to all these places, you know, to sharing what we know then and impact and then the benefit of that. Doing our own series of summits, including RAS starting from last year's, and having distributors all around the countries and to spread these good news. And that was obviously something that we started off, but if it wasn't for all of you guys, it probably was impossible, right? And Gladwell points out in his book and talks and quote, if you want to bring a fundamental change in people's belief and behavior, you need to create a community around them where those new beliefs can be practiced and expressed and nurtured. Today at RAS and this Regenerative Aesthetic Exosome Summit, we are here as a community of believer on exosomes. And I'd like to highlight all of you guys that we are at a tipping point. We're living in the tipping points of spreading this good news of exosome. Instead of fear of living in a pandemic of the virus, we are living in a joy of good news, right? That are spreading fast. The exosome is next big thing in a medical aesthetics. And 2018 is when we first started off. And in US, we have 3,500 accounts alone that are carrying out using our products. Globally, we have 15,000 providers around the globe already using our products. And there were already about 1 million cases of the treatment utilizing our products globally. And this is not about to stop. And it's growing faster than ever. We definitely are in tipping point. Today, I have to basically call out the guy who's responsible for this. And I know all of you guys probably know this name, Mr. Jo Byung-sung. And he is really the person who's responsible for this tipping point. Mr. Jo, would you please come out and stand for the crowd? Get the standing ovation. Let's give him a big round of applause.
Founder and CEO and CTO of Exobio. First of all, it's our privilege to have our great minds in global exosome industry. We are very proud to present our today special scientists and doctors and distributors at the same time, at the same place. I believe, so it was my great fortune to start Exobio about 7 years ago. And actually, just after incorporation, I went to Mission Viejo, California to see Ethan, and we found that the two guys had the same idea and strategy and vision on action-based regenerative aesthetics. Also, before I incorporate Exobio, I tried to co-work with one great scientist, Dr. Sai-Kyung Lin. She's here, and she is the world's first MSC exosome discoverer. Next slide. Okay, please let me just share 7 or 8 slides for my presentation. You can check the Google trend on how many people are trying to find exosomes. As you can see here, for the last 20 years, there has been very steady and nice increase in terms of search. When I start my presentation, I usually start with this slide with 9 questions. From my experience and my journey for the last 7 years, I found that these 9 questions are very important to, especially for you to decide or find or how to move forward in terms of in this exosome-based industry. Why Exobio has been committed to be the leader now and in the future too. And why we are the leader? Because we are the biggest investor in exosome industry. Exobio was strongly backed by Korean venture capital investors, and we have about 10 investors back there, and they supported from the beginning Exobio to be the global leader. So that's why we have a brand new and top tier manufacturing facility named ExoGMP. I believe that most of you guys visited our manufacturing facility to check the future of exosome-based drug development. And in my view, the most important thing is publications or scientific evidences. So we spent a lot of money to prove the feasibility and the potential and the safety of exosomes with our 16 publications. Especially this year, we have generated 6 publications. 3 of them are non-clinical, and the rest of them are clinical studies. And actually, Dr. Jan Rattebar here, he's one of the top exosome scientists. He has been guiding us. He's managing our R&D team as our chief strategy officer. And then to protect our business, our providers, our distributors, and our partners around the world, we have generated more than 55 patents. We are in terms, definitely we are the leader in to find a new scientific discovery and training patent. And also for last 4 years, we have been seeing about 1 million cases around the world, which means that our technology and our product has been proved in terms of efficacy and safety. So please remember these 9 questions and to choose your right technology. Here, this is yesterday. Here, this year, I invited a very special guest. You can see that Kevin Hickok. He's a CTO of Directed Biologics, which is another US exosome company. And he's the only person who has phase 3 clinical study based on MSC exosome to treat COVID-19 ARDS. So he's an expert in exosome CMC, and ExoBio hope to co-work with him. And in the middle, as you can see, there is Dr. Sai-Kyung Lim, and she has been always with us. Actually, she has been scientific advisor for the last 6 years. Again, Dr. Jan Rattebar, he discovered for the first time RNA delivery mediated by exosomes. And also in Seoul, we have about 110 people for R&D, manufacturing, quality, something like that. And another about 40 people in Mission Viejo, California. They are all committed. And you saw this, the world's largest manufacturing, GMP manufacturing facility for exosome production. And we have been investing in this facility $26 million. And we hope to provide more products. And our plan is to provide 4.5 million vials per year, which is about $200 million worth from next year. And in this building, you are seeing that the actual operation to produce fully GMP compliant exosomes. And of course, we need to upgrade this process further, but I believe that the production capacity and the quality control level is the top tier. We are second to none. Next slide, please. So we call our manufacturing process SSCRT. It's patented in Korea. But our major pipelines are human stem cell derived exosome and plant stem cell derived exosome. We do not use the whole plant. We are utilizing plant stem cell derived exosome for best quality. But we have 2 different types of exosomes from microbes, or we have a very nice publication this year on exosomes derived from animal or canine mesenchymal stem cells too. And most of our exosomes have been registered as cosmetic ingredients for now, but definitely in the future we hope to file an IND in the future, maybe 2 years. Next slide. So this is the part of our scientific data. You can see that for next generation regenerative aesthetics, we found 3 pillars of mechanism of action. The first one is anti-aging, the second is rejuvenation, the third is anti-inflammation. I know, but I'm talking pillar business, but our skin is the biggest part of our organ, which contains the biggest number of stem cells. So in our view, the anti-aging of our skin starts from the loss of adipose stem cells and the loss of their exosomes. So by providing high quality exosomes, we hope to be the ultimate next generation regenerative aesthetics. And part of our commitment is to develop large stem cell exosomes. We found, actually, under the guidance of Dr. Jan Rattebar, we just submitted our manuscript for publication on large stem cell exosome. Actually, this is the world's first plant stem cell based exosomes. And we we found that some of the science or scientific discoveries is they are very similar to humans. But one thing is that what we found is that rose stem cell EVs can induce our cells, our skin cells or stem cells to release more exosomes. So I believe we found that there is a strong link between plant stem cell derived exosomes and our skin, maybe. And as I mentioned, that our doctors or our providers are generating more and more clinical cases around the world to help patients. We found a lot of cases, and this event, you will see about 10 very nice cases generated by our providers. Next. That's why we have this award. As you know, Exosome, our product became the best cosmetics this year, AMW Monaco. And as far as I know, Exosome is the first Asian company to achieve this trophy at AMW Monaco. We are very proud to this event. Next slide. So again, we really appreciate your joining this event. We have 200 participants from 26 countries. Thank you so much. Next slide.
Thank you. So now we would like to welcome Dr. Michael Gold. We're about to start the first session of the night. Please get comfortable. We have 5 hours of a lot of science and cases, so please welcome Dr. Michael Gold.
Hi, everybody. So first I want to, from all of us here, we want to thank Byung and Ethan and all the teams from Exosome and Benev for putting on this event and bringing us all here, and beautiful Seoul, and thank you all for being here, and how about a big hand for those two? So I'll tell you a little bit about me later, but I'm going to be the chair of this first session, and I'm going to use a little cheat sheet because our first speaker this is a privilege, right? You're all in for a privilege. So Dr. Jan Lotval is a Swedish clinical allergist, scientist working on transitional research, and he's the former director of the Keftering Research Center in the University of Gothenburg. For our world, he has contributed to the early research of extracellular vesicles, such as exosomes and microvesicles as shuttles of RNA molecules between cells. And they were the group that showed mRNA in exosomes are functional when taken up in recipient cells. He is also the part of the European Academy, a member of the European Academy of Allergy and Clinical Immunology, but he started and was the first president of the International Society for Extracellular Vesicles, which is a society we all need to be part of, okay? So you can tell us more about that. And again, he is one of the 3 reasons that I'm putting out here why we are here today with our other 2 distinguished guests. Thank you all for being here. So John, you are up first, and your topic is harnessing exosomes for advanced biologic therapies.
Thank you so much. It's an honor to be here, actually. I've been working on exosomes or extracellular vesicles, and I will jump between those 2 different wordings, terminologies. I hope you forgive me for that. I've been working on it for almost 20 years. And just after we published our first paper, people wondered whether we were crazy because what are those exosomes? Nobody knew what the exosomes were. And it took a while for people to really pick up, and actually almost 10 years before this first company started. And it's a privilege for me actually to be here, because this community is the first to adopt the exosomes for clinical use in a professional way. So I think it's great. Now I'm going to talk a little bit generally about extracellular vesicles and what they do. I come from University of Gothenburg. I'm involved in International Society for Extracellular Vesicles. I'm the editor-in-chief for the journal, which has an impact factor of 17. I consult for Exosome. I've done so for almost 3 years, I have my own startup company in Gothenburg in Sweden. Now, exosomes, I'm sure many of you just heard about exosomes a few years ago and wonder what are they. And actually, when we start thinking about what they are everywhere. They are everywhere in our body. And here's a bronchial biopsy from a young man actually, healthy man, where you can see fibroblast here, myofibroblast perhaps, but you can see a lot of vesiculation around this cell. But you can also see round structures quite far away from the cell. And here's another magnification where you can see down to 50, this is 50 nanometers, this little thing, which is the smallest size of an extracellular vesicle. So our whole body and interstitial fluid has these exosomes in it. And maybe the interstitial fluid is not a fluid, but actually colloid because of the sometimes high concentration of extracellular vesicles. So all the cells in the body release extracellular vesicles. All the body fluids that we have different amounts of extracellular vesicles in them. And it varies from body fluid to body fluid. And we exchange these vesicles between us in kissing, for example, or lovemaking, or things like that. There's a huge amount of exchange of extracellular vesicles between two individuals. Now, if you look at these vesicles, they are double membrane vesicles that have a lot of membrane proteins on the surface. So these are the standard proteins, the CD81, 63, and CD9, but also many other proteins. And you can engineer these vesicles to have certain proteins that enhance their traffic to specific cells. And we've been working a little bit on that in my lab over the last few years. And as you mentioned, and Byung mentioned, I would say, stumbled on the extracellular RNA in exosomes 2004 or 2005, and then we wondered what was that, and then we figured out that RNA is certainly not staying within the cell, which was a dogma at the time, but actually leaves the cells and can be taken up by another cell and can be functional in the recipient cell. So that was a pretty big thing at the time. Of course, I lost grant because that was an artifact most likely. Now it's going much better, fortunately. So I'm a clinician background, so I want to utilize this system to develop medicines and use extracellular vesicles as medicines and to deliver things, but also to use their intrinsic capacity. And you have to be very careful of choosing the right source. So we will hear more about mesenchymal stem cell exosomes, a little bit from myself and also from Sai-Kyung Lim a little bit later today. I will show you a little bit of data, just one slide of data with bacterial vesicles, which actually are very powerful as well. Or you can use so-called engineered cells, which are pretty much inactive. The exosomes are not regenerative in their own right, but they can be engineered to carry molecules that are therapeutic or regenerative or anti-inflammatory. And that's probably future development we'll see in the field. So just one slide on bacterial vesicles. And we developed a specific bacterial vesicle from E. coli that became non-toxic. So bacteria release vesicles all the time, and those vesicles contain LPS and a lot of other molecules that cause a lot of inflammation. Actually, they can cause sepsis just by themselves. And we use these vesicles. We detoxified these vesicles, so they were not causing those side effects. And then we have tested them in different systems. We have created vaccines with them, so we have bacterial vaccines using these vesicles, but we also tested them in cancer. So we inject these vesicles directly into tumor tissue, and we tested multiple types of tumors, and most of them it works. And this is a rapid growing melanoma tumor that doesn't inhibit their growth with checkpoint inhibition. But with 2 different doses here of bacterial vesicles, we can actually totally stop the growth of these tumors in these mice. And we've done a lot of research, probably 4 years of R&D with this approach. And our goal now is to, within the next 2 years, try to go into clinic with these bacterial vesicles. But the absolute opposite then is to create anti-inflammatory treatment, not to induce immunity, but actually inhibit inflammation. And clearly the mesenchymal stem cell exosomes are a preferred platform for that, because they have this intrinsic anti-inflammatory activity. And you want that if you want to treat inflammation, and maybe you can enhance them by supercharging them, by loading them with different types of molecules. And then I mentioned the HEC293 cells that by themselves are not regenerative, but can be engineered, and that's a big part of our research right now. So we should be aware that the target cells, most of the target cells are immune cells in the body. Also in the cancer, for example, that I just showed, dendritic cells take up the bacterial vesicles and process them and create immunity against a tumor. But also macrophages are responsive. So the mesenchymal stem cells can be taken up by these two major regulators of inflammation or immunity and attenuate that reaction. And that's an important part of what the mesenchymal stem cell exosomes can do. Now, one thing I want to remind people, and not many people know this, right? But stem cells are not one thing, not at all. So there's a lot of hype around inducible pluripotent stem cells. And here are exosomes that we purchased, actually. We purchased the supernatant and isolate the vesicles from ourselves from iPSCs. And you can see here that these vesicles are not anti-inflammatory at all. They are pro-inflammatory. So there are companies trying to develop these iPSC exosomes as anti-inflammatory treatment, but I would be questioning that. Whereas the mesenchymal stem cell derived vesicles are anti-inflammatory. And in normal doses, you get around 50% inhibition. This is a supra maximal dose, I would say. Now, the first study I was involved in with mesenchymal stem exosomes, which made me really excited about this, was a study, collaboration with a group in Southern California, where they studied a model of MS in the mouse. So this is a neurodegenerative model. And this mouse right here was treated with exosomes and had the induction, and this one was not treated with that. So you can see quite pronounced. And actually, this is only single dose treatment as well. So it's pretty spectacular effect that this inflammation or this inflammatory process was attenuated in this neurodegeneration. And here are two types of exosomes that were given, and both of them significantly reduced this MS-type inflammation. So if you look at the literature of mesenchymal stem cell exosomes, there are a lot of basic data. And I would say basically whichever animal model of inflammation that you put mesenchymal stem cells into, you will see an anti-inflammatory effect. So there is clearly an intrinsic anti-inflammatory effect of the mesenchymal stem cell exosomes. So there are not too many clinical trials, unfortunately. I will not go into the split phase study or the studies that ExocoBio have done. Others will do that. But there are a few that have come out in the last few years, and some of them have focused on COVID and cytokine storm in COVID, and have indicated safety and maybe some anti-inflammatory effect, but the studies have been small and not double-blind and placebo-controlled. This is from Iran, and this is from China. Another approach that you might have heard of using exosomes to treat COVID cytokine storm is this engineering of CD24 on the surface of the exosomes. And that creates an intrinsically active anti-inflammatory exosomes. Now that's from HEC293 cells. And they this Israeli group, they tested these vesicles with CD24 in COVID in 2020 and published in 21. And they did have a significant effect in these patients. But again, the study was not controlled. So as I said, most of the maximal effect is mostly around 50% with extracellular vesicles from mesenchymal stem cells. And this is in vivo experiments of sepsis in our lab, and we consistently see around 50% inhibition of inflammation. Now, as a clinician, that's not sufficient for us. We want more than 50% inhibition of a severe inflammation, certainly. So if we can move forward, if the mouse could work, we have developed a method by which we can create vesicles directly from the cells, which we call synthetic eukaryotic vesicles, and we empty these vesicles. They don't have DNA and RNA, they're kind of empty, and that allows us to load them with different things. And you can see here that this effect of the exosomes, here are the exosomes, here are the empty synthetic vesicles, it's exactly the same, so you don't reduce the effect at all. This looks complicated. It's really not so complicated because we're targeting this is a cascade of inflammation that happens, for example, in sepsis, and you have activation of TLRs, toll-like receptors, and there are a whole number of different second messengers that are activated to create this severe inflammation. We have targeted with a peptide a grail target, which is MyD88, which is impossible to target with small molecules. So when we add this peptide in vitro, we see some anti-inflammatory effect. We see the same level of anti-inflammatory effect with the synthetic vesicles, but we combine them and get these peptides inside of the vesicles. We have around 85% inhibition of inflammation. In vivo, the peptide is totally inactive. It doesn't get to the target cells, whereas the combination here is again about 85%. So you need to get these peptides inside of the vesicles, which allows them to be taken up by a recipient cell, and there the peptide targets the MyD88 and stops that severe inflammation. So you can imagine using this in the emergency ward in a patient that has a severe inflammatory situation. So in summary then, mesenchymal stem cells are intrinsically biologically active. The efficacy to a great degree is some activities is present in the stuff that is inside the microRNAs and so on, but a lot of the effect is actually located in the membrane because you can remove a lot of the cargo and still have effect. So we've loaded MyD88 peptide, and we've loaded cyclosporin A and some other molecules, and we always see synergy, so you can enhance that anti-inflammatory effect of the mesenchymal stem cell exosomes to quite pronounced effect. Now, of course, when you are treating patients, you need to have a GMP manufacturing. That's very important because you need to concentrate, you need to purify, and you need to characterize the vesicles in a good way. And that's very important for quality control. And of course, any medicine that we use this GMP manufacturing approach. We need to determine which proteins are there, which impurities are there, and which proteins that should be there. Here are some examples that have been discussed. One thought among some people is that we could isolate exosomes from blood and use them as therapeutics. Now we should remember that when you isolate exosomes from blood using normal techniques such as centrifugation and so on, you get a huge amount of lipoproteins. And here you can see particles that are isolated from blood. And they don't look anything like the exosomes. This is actually highly purified exosomes through multiple steps from blood that have this cup shape, donut shape, whereas the rest of the blood is extremely contaminated with lipoproteins. So be aware of that. In summary, I think there's a great opportunity of developing mesenchymal stem cell exosomes as therapeutic. We can make them really powerful if we develop techniques to load those vesicles with appropriate molecules. The MyD88 peptide is only one example. There are other opportunities as well.
Cyclosporin A also only one of several opportunities, but there's certainly great chances of developing exosomes. If we look a little bit later into the future, I think the HEC293 exosomes, maybe 3 or 5 years from now, will be something that we will be talking about much more. Thank you very much for your attention.
All right, that was fabulous, and it was a great introduction to what we're here for. And again, I think for a lot of us, having these folks here is very important for us because, again, for a lot of us, this is brand new. And we hope that when you're done this afternoon, that the brand new becomes something that really makes sense and is really important. So I'm going to talk about, I'm going the wrong way. Wait, you want to get me back to the beginning? That was my, no, all the way back. All right. Which one do I? Okay. All right. So I'm going to talk about exosomes from the dermatology point of view, which I think is great. And again, I want to thank Ethan and Byung for having me part of this. So I'm a dermatologist. I have been for 35 plus years now doing dermatology. I have lots of academic appointments, and for those that don't know me, right, number 3 and number 4 up here was my pre-COVID world. Every 4 to 6 months I was in China teaching them, but they were really teaching me. And then if you look at number 5, I am the editor of 2 journals in dermatology, which is really a love of mine now. I didn't really think I'd love it as much as I do it. I get between 1,500 and 1,800 articles a year that my team and I go through and try to figure out what to publish. We took a journal, the Journal of Cosmetic Dermatology was quarterly. Now it's monthly. And we have a big team now that helps me do that. So again, all right, we're doing the middle thing, right? Sorry. All right, so this is not the most fun thing to use. All right, so, and again, I'm being sponsored by them, so you need to know that. All right, Byung showed this chart, all right? And if you look here, this only goes out to 2019. And if you think about where we are in 2023, this Google trending thing is off the charts. There is not one person that comes into our clinics now that doesn't ask about exosomes and what we do with them and what are they and how do we use them and those kind of things. So I apologize here for a sec. All right, so this is my favorite slide that I borrowed from a very close friend, Glennis Ablon in California. Above the water is what we know about exosomes as a dermatologist or a plastic surgeon. Okay, I'm gonna put plastic surgeon in my world too for a minute. We are just beginning to understand this technology, and it's gonna take the community, as Ethan said, so that we can all speak the same language and understand it the same. We have so much more that has to be discovered in our world, and that goes back to the clinical science part of it and the research part of it in the dermatology and plastic surgery and regenerative world of medicine that we live in. And that's all important for what we have to do. There are, however, some really nice review papers. And again, if you were here, if you were at the meeting yesterday, this is a repeat, but I'll try to be a little bit different. A couple times I'll say, take pictures. If you want to take pictures, I never care if people want pictures, take them. But there are some really nice review articles that have recently been published in dermatology that tells us about what the trend are for skin remodeling, for pigmentation issues, for scarring, for alopecia. Another one in the journal I edit, what the role is in skin diseases and where we may be able to take this field someday, and I think is really important. I'm not going to bore you with the details of exosomes. This is part of a lecture that I give, and I'm going to highlight just parts of it, right? And because again, you've heard this term extracellular vesicles. If you asked Michael Gold 5 years ago what an extracellular vesicle, I wouldn't know what it was, all right? It wasn't part of what I learned. And then we know their communications, and we know they're gaining increasing attention, and again, how we use them and what they are. So anything in red to me is important, okay? They're extracellular vesicles. They contain nucleic acids, DNA, mRNA, and miRNA, as we have heard before. And exosomes are the smallest part of what is an extracellular vesicle, right? And other things, they're microvesicles and apoptotic bodies as well. And as we just heard from Jan, they're part of almost all our body fluids. Blood, urine, saliva, breast milk are all constitutively secreted, and they play an essential role in pathological and physiological conditions by manipulating cellular communications, eventually gene expression. So the potential here for us is massive. What we can potentially use these for in our skin problems and skin diseases and regenerative medicine and aesthetics is endless. We got to understand it though, and we've got to pick it out piece by piece by piece to make sense so that we're doing the right thing for our patients. So why do we need them, right? That's a question, because they give us regenerative power, and that's important. Again, we've talked about this, so we'll skip a couple of things. And we know that these things, the exosomes contain, as I said, growth factors, messenger RNA, microRNA, and they can be separately engineered, as you just heard, and we can use these for our skin or for our hair signaling to enhance what we have and to enhance the patient responses when we do these kind of things. And they're really small. And so again, the exosomes here are in the green. And I think that we just saw that in the previous talk, but these are really small targets or things. All right, this is the most important slide I show. I showed it yesterday, I show it in every talk that I do. So if you're from North America, our rules are totally different in how we can use exosomes than probably the rest of the world. So I read most of this slide because I think it's important. The FDA, friend or foe, they are my friend now after 35 years of doing clinical research and having a father, some of you may know, who was a infectious disease doctor who basically did the rubella vaccine, the first influenza vaccine. He developed a drug that you may have heard of called cefazolin. And so the FDA became part of my life, and it's there for safety. Everything is safety. Efficacy is second, but safety is why they're there. So the FDA regulates regenerative medicine products. These continue to be broad marketing of unapproved products considered regenerative medicine therapies that are intended for the treatment or cure of a wide range of diseases or medical indications. And this is exosomes we're talking about. These products require FDA licensure approval to be marketed to consumers. So before approval, they require FDA oversights in a clinical trial. These unapproved products, whether recovered from your own body or another person's body, including all these other parts of things, and exosomes are in there, and they had received before 2019 reports of blindness, tumor formation, infections due to the use of these unapproved products. So every company that was involved in developing exosomes received this letter. And that basically stopped almost everybody in their tracks from using these unapproved products as drugs, right? They're not drugs yet, okay? So again, we've seen a proliferation of companies in the exosome space. At one point, I counted over 80, all right? And in the United States, I think we have 8 or 10 in the skin space. They are human and plant-derived, as we know, and again, we're gonna talk about only one really today. So we heard from Byung at the beginning, there's some important things that are really important here. Cell line development, scalability, upstream cell culture, downstream purification process, really good quality control, being able to have a shelf life that makes sense, all the regulatory conditions, and again, where they are derived from. And again, there are different things that you can derive from, as we all know. We'll focus on the mesenchymal stem cells mainly, and this is this partnership that brought us all together, right? And so we all believe in what they're doing, mainly because they're doing something correct, at least in the eyes of us, but also in the eyes of the FDA. And again, in North America, it's a different ball game than the rest of the world, but it's also it's where everybody needs to look to for safety and all this other stuff. So again, but this is also an important thing. This is for North America, right? These are post-care topical use cosmetic solutions. In North America, we cannot inject these products into people's faces or scalps or any other part of their body. It's against the rules. So we are stuck using these topically. Again, that's not a bad thing until we have the science and until we have everything, until they spend the money to create a drug, we can't do this. The FDA can come in our offices if they find out and shut us down. They're not going to shut the company down, but they can shut us down because we're doing it. So they actually go by the International Cosmetic Ingredient Nomenclature Committee, and the name human adipose stromal cell exosomes was given and published by the International Cosmetic Ingredient Dictionary, which is the big book. And these products are not drug products. They are not intended to prevent, treat, or cure diseases or medical conditions, and they are not intended to be injected or delivered intravenously. So if you're a dermatologist, like I am, they are not intended to prevent, treat, or cure diseases, right? I cure a lot of diseases, but I also treat a lot of diseases where we have no cure. So dermatologists are really good at treating things. I can look at a rash, I can look at a condition, I know how to make it go away. It may not cure it. So I'm pretty used to that. And I think we all have to get that behind us and understand that. But again, they are not to be injected or delivered intravenously. I will repeat it 100,000 times. All right, we were there this morning, the US contingent and the Canadian contingent. There's now a second building going up because they have run out of space. Again, 55 patents, 8 US patents, 16 published papers. I run 2 journals. I want papers. I want to see the science behind this. Unfortunately, in the US, we want the US data, right? And again, I look to Ethan and I go, thank you, because we're doing it, right? It has to be done, and it has to be done a certain way. And we know from all the work that they have done before, this stuff should work in a lot of things that we're interested in, regenerative and aesthetic medicine. We know it increases elastin. We know it increases collagen. We know it increases human fibroblast cell proliferation. That's the bench work that we've been able to do, or they have been able to do, to get us where we are. And we can combine it with devices, and we're working on proving that this combination is really special. And again, I think you're going to see a lot of cases today of lots of different combinations where this works. This is the only paper in aesthetic medicine that we have, right? Period. There is none. Again, we have to do this in the United States. And again, we were talking before, Jan and I were talking, this is the split-face, double-blind, placebo, randomized controlled trial. Hard to do in the US to get ethics committee approval to do these kind of trials on the face. They can be done off the face pretty easily. But again, this showed better efficacy and shortened treatment time for these patients. And so when you look at patients, and I'm just going to go quick in the last couple minutes, all of these patients have been treated with a procedure immediately post-topical application of exosomes, the Exocobio and Benev exosomes together to give us a better clinical outcome, right? And time again, we shorten the downtime. We think we are enhancing the cosmetic outcomes. We know we are, but again, we're going to prove that. And everything gets better faster. And so, you know, you take a patient like this, and I can put this patient out for 2 weeks with what I can do with some of my devices. And if I can do this and put them only have downtime for 1 or 2 days, they're going to love me, right? And they're going to get great results when we do this. Again, using some, you know, pretty aggressive techniques, but again, we improve everything, make them better faster. And that's the goal of what we're doing. And again, the clinical work shows that we can use this both on the aesthetic side, but this is more of a medical condition, right? Post-procedure, radiation therapy, burning and irritation, we can do this. And then again, wounding, and this affects all aspects of the wound healing cascade, and we can heal wounds really fast. And so that's where it gets important, again, with more of our procedures, with exosomes on one side, without exosomes on the other. You see the decrease in erythema. That's what we're looking for. The improvement here in the acne scarring post-procedure. Again, this was a skin necrosis. Again, I would never have thought of using exosomes in this kind of situation before. We're good at healing wounds, but now I think I'm better at healing wounds, and that's important to me as well. So again, really bad acne scarring, doing our procedures, healing the skin a lot faster. And again, we think that the exosomes are helping in that cascade of wound healing post-procedure with our needling or with our CO2 lasers to make our patients better. So everything gets better with this. And I'll end with one of my patients who thinks this is the best thing that they've ever done. And that's what I wanted to share with you today. So thank you all very much. And so now, and we're going to have a question and answer after the second session. So if you look in your program, there's 2 sessions, and then we'll have a question and answer, and then I think we'll have dinner. But now it's my pleasure to introduce a very good friend. Dr. Renato Saltz is a plastic surgeon based in Park City, Utah. He runs a bunch of different meetings in the United States, and one is the Brazilian meeting. It's a Brazilian American plastic surgical group, but it's in the United States, right? And then he also is involved in global aesthetics, right? Which is in Miami. He's been part of other things that I've known for years. I've watched his incredible work and teachings for a long, long, long time. And he's going to talk on aesthetic surgery and cosmetic medicine strategies for success. He's going to tell us how to do this in a practical sense. So Renato, you're up.
Thank you very much, Michael. Really hard act to follow. I didn't plan this, but Ethan mentioned The Tipping Point, which is one of my favorite books. And my wife and I read it many times. And what he did not mention is a chapter that talks about Paul Revere and his importance during the English invasion or attempt to take over the United States early on. And in that chapter, Malcolm Gladwell talks about connectors and leaders and why one person can do a lot of things that many others couldn't. And that's how I see you, Ethan. You're a very unusual CEO. I know a lot of CEOs. I know Michael knows a lot of CEOs. We work with them. And you just came to the US scene and start bringing people together. And always in this very humble, friendly way. And so I congratulate you the way you do things. And now that I met your partner, Mr. Cho, I can see you guys work well together. So I really appreciate what you've done and introduce us to this world of exosomes and Silvermax. And what I'm gonna do is show you or share with you how these things work in my practice. And I'm sure there are a lot more smart business people in this audience, and I'm sure you have many different ways to do this, but it's working well in our practice and how we incorporate all these things, surgical and non-surgicals, in a busy aesthetic practice. So, I'm sorry. That should be the end of it. Okay, I got it now. I'll go with the, so this is actually this is part of a whole book about mixing aesthetic surgery and cosmetic medicine, but I'll try to focus and do this in a short period. I'm double boarded. I'm board in general surgery and plastic surgery, and I've been involved with societies pretty much all my academic life. And it's a good thing because it exposes you to a lot of different people, different countries, different modalities, and you learn to appreciate what is done all over the world instead of just focusing in the United States. So another reason I'm here, I wanted to learn more about what an exosome is, and just listening to my colleagues yesterday, today, and hopefully tomorrow, you know, it's been a wonderful trip. So thank you for bringing us. This is my disclosure. I'm involved in several advisory boards, and I think it's great. I really push my residents and my fellows and colleagues to get involved with the industry. In the 80s, when I was a resident, was a bad thing. And I think it's very important because working with them, we get better products and better treatments for our patients. So that's what I do, and I published 7 books in plastic surgery. Okay, if I can get this going, Mr. Chairman. Little button on the mouse. Okay, here we go. So we're talking about exosomes, we're talking about disruption. And disruption has been great for plastic surgery. Disruption has been a very important part of what we do, and it's not necessarily a bad thing. Disruption has happened to our patients in aesthetic surgery, especially right after my training in the mid-90s when neurotoxins became popular. And the patients are very aware of all this. The patients want to have procedures done. This is really not going. Okay. Patients are getting old, and not all of them want to have surgery. So they want to remain looking young. Okay, go this way. You know, the timer is still going. And I know he's very tough with the clock, so. Okay, here we go. So patients are getting old, and they will do whatever they want to do to remain looking young. And surgery sometimes is not the first option. When you look at the statistics, especially from the aesthetics side, which is the best statistics in surgery for us, you notice the red line is surgical procedures, and the green line is non-surgical procedures. So the surgical procedures are growing at a very different pace in the United States. And then you look internationally, this is the last one we had from the ICEPS, our global survey. Look at the number of procedures. They continue to decrease every year, while the non-surgical procedures continue to go up every year by 10% or more. So, I'm sorry. Here we go. So in 2002, after spending 13 years as a full academic professor in plastic surgery, I realized I gotta do something about it because the University of Utah wouldn't let me open a medical spa, wouldn't let me buy devices or anything different than traditional surgery. So we went into private practice, and the goal was to deliver pre- and post-surgical care with medical spa treatments under the direct supervision of a board-certified plastic surgeon. So, and why I did that? Because I always follow this statement that if you don't change, if you don't modify your what you do, most likely you're not going to survive. And that's true also for our specialty in aesthetic surgery. So we opened 2 practices, one in Salt Lake City and one in Park City. And that small hospital is a very nice boutique hospital in Park City. It's a beautiful place in the mountains. Come and visit us, and you're going to see a totally different way to deliver excellent medical care in the mountains of Utah. In this, you know, we can spend hours talking about this whole presentation. I'm going to focus just in some areas where the non-surgicals play a very important role, and I'll include Silvermax, I'll include exosomes in that part. This has been published in 2012 in this book that we published with some excellent co-authors that covers all aspects of this talk. So the facial aesthetic package was created in the office for to bring together our patients, our practice. This is really not working. Let's see this way. Yeah, the other way. Here we go. I'll learn. The facial aesthetic package was just a way to create a system that staff, patients, everybody involved in the patient care would understand how we do things. And I'm sure you have different ways to do it. And it's divided in 3 components: the pre-surgical component, the intra-surgical component, and the post-surgical component. So all these patients that come in for, let's say, a facelift, they're gonna go through this. And everything starts with the consultation. And to summarize the facial aesthetic package, you can think of, she's coming in for a smile and she gets the whole treatment done. And that's how this concept is better explained to patients, because I know if I don't offer, she's gonna fly to Nashville and Michael is gonna take care of her. So you wanna keep the patients with you, you better be ready. And this is a perfect example. This is a very beautiful lady. She was 63 or 64 when I first saw her. We did a whole preoperative preparation. Then she went through surgery. And then postoperative, she continued to be seen by our master estheticians. And you can see here, 4 years later, she's still looking very good. And I see her maybe once a year for pictures, but she comes every 6 months to be treated by our master estheticians in all these non-surgical procedures. And this keeps these patients in the house, keeps them very happy, and it's what I call patients for life. And we'll talk a little bit about this later. So it always starts with a consultation. And that's really my important part of the whole process. And the consultation is really a team approach to educate and treat patients in all aspects of aesthetic surgery and cosmetic medicine. And one of the things I really like, and you are welcome to take a picture of this, is a treatment plan. And the treatment plan is outlined by the surgeon. So I have this consultation with a master esthetician next to me, my PA or my nurse, and that's when I outline what this patient's gonna do. So look at where Silfirm and many times Exosomes is part of the treatment for scars, for skin laxity, for wrinkles, for hair loss, for crepey skin, wrinkles, fine lines. You know, it has become an integral part of what we do. Post-operative, these patients come back and they have all these treatments, as I was gonna show you later. Another important aspect of a successful marriage, successful combination of surgery and non-surgical procedures is, what do you have? What do you offer in your practice? So I'm a firm believer that you have to be innovating, you have to be competing, you have to stay ahead. And if there's a new exosome in Korea, I want to know, I want to learn about it, and I'm learning a lot, and that's what plastic surgeons should do. And we carry a lot of stuff. We have 2 medical spas, they're very busy, and we have patients coming from all different states, so you need to be ahead of the competition. So when Silfirm became available, and we had Ethan and Dr. Na coming to visit us, and was a very interesting couple of days in the office, because we have the demonstrations by Dr. Na, and then after the treatment, he showed this, let me see if I can make this video work. He showed this little vial, and you have volume? And this magic little vial, and
decrease healing time.
so Megan just had a treatment with the Silfirm by Silfirm's creator, Dr. Na from Korea, and now Patty is applying Exosomes. Here's Dr. Na. Thank you for joining us. Thank you for coming. Welcome to Utah.
My pleasure. Yeah.
Megan loves it. Look at her face. Say something.
Well, I
Megan.
really love the massage, the after massage from Dr. Na. That was the best.
My goodness. Okay. So now you have to stay with us. You're a new member of the Souls team.
Thank you so much. You enjoy new technology of Pulsed Wave with Silfirm Max and Dr. Na's special massage together. Yeah. Thank you.
So this was it was totally news to me, and from that first visit, I started learning more and more about this product, and which brought us here today. So in the last 2.5 years, we've been using several combinations of Silvermax with Exosomes. These are some of our own patients with improvement, and you're going to see a lot of case studies today. So I'm not going to bore you with this, but it's been quite incredible. What I like the most is when we combine in our surgical patients. These are patients that come in for facial rejuvenation, and we get them right on some of these treatments. And you're gonna see some incredible results here, which is not necessarily because of the surgeon, but because of all these non-surgical. This is a 74-year-old patient for full facial rejuvenation. Underwent at 3 weeks. She sent me this picture. She was going to vote actually in November. We're all very surprised with the amazing preliminary results she had. But she continues to come back. And here she is at 6 weeks, and we started immediately back on the non-surgical treatments, especially Silvermax and Exosomes. Again, this is all subjective. This is not scientific. And here you see her at 1 year. She continues to look better and better. I mean, this is amazing. This is not your typical facelift result, even by salts at 1 year. So the credit goes to all these non-surgicals that she's getting. And if I could just advance this. Here we go. This is another patient from Newport Beach. The post picture she sent to us. She went to see a colleague there for the post-operative picture at 6 weeks. These are great results. Continue with radiofrequency microneedling and exosomes. And these are just some of the patients we're now using and getting this kind of results with improvement in the quality of the skin in their 40s. In their 50s, used to be a smoker, New York, a lot of sun damage, and we're getting this continue improved results that it didn't happen before. This is a 60-year-old from Southern Utah, a lot of sun damage. These are difficult cases because you have a skin that doesn't respond well to standard treatments. So we're treating them now with a lot of radiofrequency, a lot of microneedling, in aggressive exosome topical treatments, as Michael pointed out. And I have a couple more if I can get to advance this. Maybe we need new batteries, gentlemen. This is a 7-year-old from Arizona. Again, a lot of sun damage, and we're just getting better surgical treatment that used. And age is not a factor as long as they're healthy and the anesthesiologist is willing to put them to sleep. I mean, she had a full facelift, brow lift, and again, aggressive treatments with non-surgicals in the med spa. And the concept of patients for life, and I'm finishing, Mike, it's a very important concept. I want you to take this home. These are patients that will stay with you and your team until they're ready for surgery or continue non-medical procedures. And I think that's where non-surgicals play a huge role. This is a facial rejuvenation surgery combined with med spa treatments, age 52, day 4 at 3 years. These are all full facial rejuvenation. Patient from Hawaii with a lot of sun damage at 1 year, and now she's at 3 years out. These are happy patients. They fly in just for treatments. This is a patient from Baltimore, East Coast, 66, 1 year post-op, and now she's at 6 years. Notice she looks better every time. And that's not just the facelift. That's a lot of the non-surgical treatments that make the difference. And here you see her neck. This is a 60-year-old, 1 year, 8 years later, she looks better every time I see her. The quality of her skin looks better. It's just a big change for our surgical practices. And I have a couple more. This is a 12-year follow-up in this patient. I revised her neck at 10 years, and it looks like she's not aging. And look at the quality of her skin. It's just amazing. And this is a real long follow-up, 13 years, patient from the Middle East. She flies once a year to Utah just to get medical, non-surgical treatments in the office. I see her, I take pictures, and very happy. So in summary, the bottom line, which has done besides this very happy patients, has also brought a lot of money for us. These are when we first brought the 2 machines to the practice. This is the first year in 2020, 3 months. Then this is the second year, 2021, and we started using Exosomes at that time. 2022, you see the numbers keep going up. Now we're doing, in 2022, we started using more and more for scar treatments. And this is 2023, the first 6 months. You see the numbers there, so probably double before the end of the year. So that's the bottom line. That's what generates in our practice, and these are true numbers. So I want to thank Ethan, Sunil, and Diane for introducing me to the Exosomes. It's been a big impact in my practice, and this is terrible. And I want to thank this group for, if I could go back, this group for their knowledge and research and advances in our field. And finally, thank Ethan and Mr. Cho for inviting us to Korea and show us their facilities. Thank you very much.
Can I get this on? Thanks, Renato. That was great. So we're going to move on. Again, we'll have question and answers in a little while. So one of the nice things about being old is I actually get to sometimes introduce somebody who spent a lot of time at my office while he was in training, and watch them grow into superstars. So our next speaker is Inigo de Felipe, who is from Barcelona, Spain, who is going to talk about exosomes in cases of inflammatory scalp conditions. So Inigo, you are up.
I understand why this was not working. So guys, when you come up, backwards is forward and forward is backward, okay? So it should be like this. I was a medical resident when I met Michael for the first time. That was in 1996, because I asked the manufacturers of a laser company, right, who's the best guy in IPL and lasers in the United States? And they said, clearly, it's Dr. Gold. You should go there. So that's why I've met him, and I've always tried to emulate him and to do things as him. Obviously, he's much more successful than me, but I think he's a model on how to be. So thank you very much for being here. Exosomes in the hair are actually very, very effective. And you've seen my presentations in the previous years. And let me focus on this guy here. It's the one in the center. I don't know how to point this. Okay. So you see this guy here, let me just come here. This one, right, was treated at the end of July in Ecuador. And this is the picture they sent me 2 days ago. So you clearly see that with just one session of exosomes that were actually injected, not like what you should do in the United States, but this was Ecuador. They're more relaxed about rules there. You see the great effect of just one session of exosomes. So what happens when we do this in inflammatory conditions like alopecia areata and so on? Okay, yeah. So, and let's talk about what happens in all these conditions and some things that we've learned with this. All right. It takes its time, all right. Yeah, all right. So, alopecia areata is an inflammatory condition of the scalp that thankfully is not scarring. So we're not destroying the hair. In this situation, many follicles go from being growing in anagen into telogen. It is diagnosed clinically. We don't really need a biopsy for this. And it's very commonly associated with other inflammatory conditions, not only of the skin, but also outside the skin. It is associated with vitiligo. It is associated with diabetes, with hypothyroidism, and the treatment usually is corticosteroids, applied topically, but probably the first line treatment is to inject corticosteroids. Some of these cases are very resistant, nevertheless, to this treatment, and JAK inhibitors have been introduced, but they're not all that easy to get. At least in Spain, it's very difficult to get JAK inhibitors, only in public hospitals. So patients sometimes are desperate to find solutions. So in alopecia areata, there's clearly a problem with lymphocytes. And these lymphocytes of the CD8 type, they infiltrate the follicle, and they start doing something to the hairs that we don't fully understand, and these hairs react by sleeping. Sorry. So what these guys did a long time ago was, okay, let's see who's responsible of the problem. Is it the T lymphocyte? Is it the follicle? So usually in alopecia areata, what happens is that, not in alopecia, sorry, in normal hairs, these hairs never show HLA receptors. So they're really not immune stimulating anything. But in alopecia areata, funnily enough, these hairs show different receptors that are found by our immune system that starts attacking this hair. So what they did was, okay, let's transfer hairs from a patient with alopecia areata to mice that did not have an immune system. And what happened was that there was no alopecia areata at all. So what they did again was, okay, let's transfer as well T cells, the T cells of the CD8 type, and still the alopecia areata did not happen. So they needed to transfer everything: 1, the hair; 2, the CD4 lymphocytes; and 3, the CD8 lymphocytes, in order to reproduce. So what we know today is that everything is needed in order to produce this reaction. So clinically, and this is very important, right, there is a lot of ICAM1 receptor in the lymphocytes that enhance this reaction and makes us develop alopecia areata. And you can see that with this stain, up there you see patients with alopecia areata, down you see patients being cured, right? They express all these receptors that are found by the lymphocytes. That's why they attack the hair, and all these hairs go into telogen stage. If you follow clinical recommendations, right, and this is what they recommend general practitioners, this is not for dermatologists, but you'll see how funny this is, right? What a GP or a general practitioner should do with a patient with alopecia areata. So the first thing would be, okay, if you don't have a lot of alopecia areata, there's less than 50% of the first surface affected, the treatment options are there: topical steroids or minoxidil, or the first line treatment, which is injections of steroids, usually injections of triamcinolone or Kenalog. Okay, so that's option number 1. And I think it's very important when we talk about new treatments like exosomes to focus that there is an order. I mean, if you have a wife, you have to invite her for vacation, not another girlfriend. Okay, so there's an order in life. You understand this, right? So if there is a treatment that has been proven to be effective, you have to follow that. So exosomes should be a second line or a third line treatment if they're approved for this treatment one day. I think Michael will help us in guiding us for that. So the funny thing here is that GPs are told this, okay, if these people don't respond, right, or if there is more than 50% of hair loss, the treatment options should be, okay, consider oral prednisone, or, and this is actually very interesting, refrain these patients to the dermatologist, right? Refer them to the dermatologist. They will know what to do. Right. So this is the list that we dermatologists would have to do in a second-line treatment. Okay, we can still apply topical or infiltrated corticosteroids, or we can go to the difensiprone, which is a very old treatment. We can do LED, we can apply JAK inhibitors or take JAK inhibitors. So exosomes are not in the list, but because we like trying things, all right, and we know that exosomes derived from adipocyte stem cells are very effective in pathologies related to this, like eczemas or atopic eczemas. What we did some time ago was, okay, let's treat patients that did not respond to these first-line or second-line treatments and see what happened. And this is one of my first cases some years ago, right? This woman has been suffering from alopecia universalis. You say it's universalis or universal when it affects not only the scalp, but also the eyebrows and the rest of the body. And she didn't respond to topical, to intralesional, to oral prednisone. So we had this option, which was exosomes. We talked with her. This is after 6 months. And that last picture there on your right is after 1 year. So after more than 1 year of that picture, we don't have any relapse. This is another guy. He's had 6 sessions of exosomes. And when he came here, right, he did not respond to oral cortisone. He did not respond to topical. He did not respond to intralesional. And we did exosomes. And this is another person. And as you can see, this is not a universal alopecia areata, but because some patients want to have something stronger and faster, we offered him exosomes. And as you can see, he has not only improved from his alopecia areata, but he's also improved from his androgenetic alopecia. And you can see here a very interesting recovery of the hair in the frontline area. And we have many patients that have been treated like this. The only question is, well, there's not only one question, obviously there's several, is whether this may have happened without any treatment. And that's the first thing that might occur, right? And the second one is, what would happen if we injected corticosteroid? So we are now going through a study in which some patients are assigned to a treatment with infiltrations with cortisone, with Kenalog, and another group is being treated with exosomes. We are comparing, and maybe in one future meeting, if I'm invited, which I suppose I will, I will share the results. So as you can see, right, there's not only a recovery of hair, there are other changes. And I would like all these clinicians in this room to tell me, what do you see that is happening when you treat patients with alopecia areata with exosomes injected? So what's happening? Yeah, exactly. So there's darker. So my first thought is, okay, it's darker because the hairs are thicker, but it's not really all that much. I mean, you can, not in this patient, but you will see afterwards in some patients, there is clearly a reduction in the number or the percentage or the proportion of white hairs in the total hair. And the second thing is that it's very effective in the frontal area. And when we do treatments for androgenetic alopecia, usually they're very effective to increase the density of hairy areas. But when we have these areas here that are naked, well, we're not really very successful. But in this case, exosomes are really very effective, and you'll see some patients afterwards. So because this is effective in alopecia areata, if we change subject and we move into lichen planopilaris, which is not all that common, and it's very difficult because the hairs have been destroyed completely, right? We have tried. This is after 1 month of 3 sessions of triamcinolone, and you can see that the patient is not responding. On the left side, you have a patient with folliculitis decalvans, and I treated him with 1 session of triamcinolone, 3 sessions of triamcinolone plus exosomes, and you see that the result or the response was much better. So maybe there is a potential effect of exosomes that we cannot get with Kenalog. And this is actually the trichoscopy of the previous patient. You see on the left, you see the areas, the white areas with the disappearance of openings. It means that the hair follicles have been destroyed. And on the right side, you see that the patient did not respond with triamcinolone. So when I asked myself, because we all have to make questions to ourselves, right? If patients receive exosomes and they improve, would they have improved if they didn't get exosomes? Well, this is the response. They didn't. I only have few cases for this, but it seems that exosomes really potentiate and improve the result that we're getting with other things. And in fact, this is one picture that Björn showed to those people visiting the factory yesterday, and you see an improvement in a scar that would never improve with anything else. And I've been practicing medicine for 29 years as a dermatologist. But he forgot to show the final result, which is this. You see where the arrow is, right? So there is a complete recovery of normal skin where there was a scar. And this is after 8 infiltrations of adipocyte stem-derived exosomes. And this is actually not happening with any other procedures. And I've been working with CO2 laser and with erbium laser. I promise you, you never get these results. Only exosomes can deliver this. So because this is working in fibrous tissue or scarring tissue, we can now move to a 4th indication, which is frontal fibrosing alopecia. In this case, we not only have the inflammation, we also have the scarring. We have the disappearance of the follicles. So it'll be very difficult to really create new follicles, right? So what happens when we have a patient like this? This is the typical trichoscopic finding. That's the typical biopsy with a band-like infiltrate of lymphocytes. So what happens is that it also works apparently, but this is only an evaluation from a clinical point of view. It's very difficult to count exactly how many hairs she had at the beginning, but obviously this lady, this is after 1 year, improved clinically, and this other improved. And what's more interesting, there is no recurrence after 2 years. Sadly, we don't have enough experience with these cases because there's, we're running out of time, but let's do it a little bit in the Spanish Latin way as well. So there are 2 things that are not related to inflammation, but they're related to something that we're learning, which is the behavior of the frontal temporal area, which is very difficult to respond in other treatments, and the response of graying and whitening of the hairs. So let me just focus a little bit on this. This is a study in which they compared dutasteride against finasteride. And as you can see, the important thing of this study is not really that dutasteride is more effective than finasteride. We all know this, right? What you can see is that the response in red, that's the frontal area, is much poorer than the response in the vertex other areas. So constantly, and this is what we're seeing with all the treatments, the frontal area does not respond as well as the rest. So when patients come to me and they say, "Doctor, can I recover the hair here?" Maybe the only answer is you have to go under hair transplantation. But maybe with exosomes, this changes. And it changes because we're constantly seeing a recovery of the hair in difficult patients. That's the trichoscopy. And you can see these areas of trichoscopy, they were taken more or less in the same place. We measured with centimeters, and there is a recovery of the density of hair. So that's the first thing that we've discovered with exosomes, that they are very effective in this area, whereas other treatments are not. And the second thing is the graying, and I'm finishing with this, but I think it's probably the most interesting topic of my lecture today. So we know that with time, hairs lose their pigmentation. And it was said that it might be related to mitochondrial DNA. There are many papers about this, but actually the content of DNA mitochondria does not change in white hairs in comparison to normal hairs. At least this is what experts say. So when we treat patients like this, we really discover that there is an increase in the color of the hair. So we don't know whether it is because we are stimulating hairs with color, or because the total proportion of dark hairs is increased. We don't really know what it is, but obviously all patients say, hey, doctor, my color is coming back. So this is one case. This is another case. This is a very interesting case because this man, and this is on the left, had an exosome plus nanofab plus LED plus dutasteride finasteride minoxidil treatment, and this is how he appeared 8 months later with just one session. So he came back from Switzerland, and this is where he came, and he wanted to do another session, and I just injected PRP, and he didn't get much of an improvement afterwards, right? But the reality is that the color of the hair improved. And this is another case. And this is another case with just one session. She only had one session of exosomes, and you can clearly see that the proportion of white hairs is lower, or the proportion of dark hairs is higher. So this is not the first time that in the history of medicine we discover that white hairs are reduced, or they recover the hair. It has happened with different treatments. It's very anecdotal, but you can see with ribavirin, interferon, one patient with pazopanib, I don't know what type of medication that is, with levodopa in a patient with Parkinson, with thalidomide, and with these medications, lenalidomide, I can't even pronounce them, they're really difficult. But this happens. This is, for example, a case treated with thalidomide, right? This is one case after several years. And this is a series of 14 patients published by some friends of mine in Barcelona, right? And this is what happened to some patients that followed a treatment against lung cancer. And what was the treatment about? It was with some agents, nivolumab. I don't even know that these medications, these drugs existed. But these drugs are interfering with a pathway, which is the programmed cell death pathway, which I will show now. So what really happens is that this is what would happen in the situation of a cancer cell. And this is probably the most interesting part of my lecture, so just listen to what I'm saying. Not all exosomes are exactly the same. This is a cancer cell, a tumor cell, and that's a lymphocyte. So supposedly lymphocytes have to defend, have to protect us against these tumor cells. So they have to kill these cells. And what happens is that once the tumor cells receives the interferon, right, this tumor cell is going to produce some exosomes containing a dangerous thing called PDL1. It's called cell program ligand that will activate the death of the lymphocyte. So therefore, if the tumor is attacked by our lymphocytes will die. It's quite dangerous. So not all exosomes are good. So if we stop this pathway, we will enhance our immune system to attack and destroy our tumors. And those medications that increase the pigmentation of hairs actually were interfering this pathway. So basically, this is the drawing that I was making yesterday for you, right? In normal immunity, we have this programmed cell death ligand, So what happens is that a lymphocyte will produce interferon gamma, which, by the way, exosomes from adipocytes will reduce. And the melanocyte, for example, right, will develop this glue called ICAM, right? And with this ICAM, they will link, they will kiss the lymphocyte, and the lymphocyte will die. So our system, right, our melanocytes are protected from being attacked thanks to having this program cell death ligand, right? If there is a mutation or something in here, right, which happens in autoimmunity or in vitiligo, for example, melanocytes with vitiligo do not have this PDL1, right? So what happens is this. The lymphocyte produces interferon, we produce ICAM, and who dies? The melanocyte dies. That's why we have vitiligo. Now you understand? So what would happen if we use exosomes? When we use exosomes, we reduce the amount of ICAM1. So we stop the kissing between these two cells. So this one lives happily together with the lymphocytes because they're not attacked by each other. And I think this is probably the way why exosomes increase the pigmentation of the hair. So just to finish, I'm going to throw to you two questions. I'm not going to tell you the answer, but these are the questions. So this is a picture from yesterday. Out of these two guys, right, we know that this big guy is younger than me, and that lady, Julius, is very young as well. But out of these guys, who is older and who has had more exosomes injected? So thank you very much.
All right, thank you, Inigo, very much. So again, part of this is to stimulate conversation, and I think with Inigo, we get some great conversation and thoughts, right? Again, outside of Spain, and if you're in the US, you can't do this. All right, so next up, Dr. Rosario Salud Abaya Blas is going to talk from the Philippines, is going to talk on exosomes in medical dermatology.
Hello, thanks for inviting me. Thank you, Dr. Gold, for that, and thank you to Exocobio for this invitation. Sorry, next slide, please.
You can use the roller,
Thank
or
you.
can try the clicker. And at the break, we're going to fix this.
Thank you. Okay, I just have to wait. Thank you.
Silly.
So every time I speak about exosomes to anyone, I always tell them that the learning curve is not really in what procedure you're going to be using to introduce the exosomes. The learning curve is in finding the answers to these basic questions. In particular, where did the exosomes come from? How it was made? Are there studies using that particular product? And for me, if the product is registered in the country of origin. Now, in my practice, I normally apply the exosomes topically. Dr. Gold will be happy to hear that. And I use microneedling deliberately because I want to see the exosomes do all the heavy lifting. And I try to refrain from energy-based devices. Next slide, please. There. So now you can take pictures of anything except for the patients. This is a patient, an 88-year-old patient who had bed sores, and she's been around the block. Plastic surgery threw her back at me because they had done everything they could. And the only thing that I had in my armament was just the exosomes because I had just arrived from Seoul last year. In 7 days, just applying the reconstituted vials, in 7 days, the patient had healed. She had very good nursing care. So nursing care is indispensable. So I had the patient's caregivers apply the reconstituted exosomes 3 times a day because there was a paper in China saying that 3 times a day was the requirement. But knowing us Filipinos, Asians, they really don't follow it. So twice a day was the minimum, but it really worked. Now that's my other patient. My other patient spent a miserable Christmas because he was drunk and then he had something, a metal rod impaled in his leg. He went to the ER, they sutured it, but it dehisced. So he went around limping until New Year, and then he was referred to me. And I said, oh, I can heal that in 1 week. From my experience with bed sores, it took a little bit longer than 1 week because my patient was apparently a vapor, a cigarette smoker, and he just didn't want to admit and stop his habits. But Exosomes did the hard lifting, did the work, and in 12 days, he was fine. Next slide, please. And this is another patient who had ameloblastoma, and the wound, the donor site, never quite healed. So he was walking around with a painful wound that never quite healed for about 2 years. And so he was referred to me, but since the patient was in a hurry to get home, I just reconstituted the vials for him and applied it and taught him how to do it. And he went home with it, and in 7 days, you can see that even the skin around appears better. And that is one of the reasons why, that slide over there, a new article, exosomes will affect positively all the stages of wound healing. Next slide, please. And this is one of our favorite patients. This is a 69-year-old patient who came in with exfoliative dermatitis. New Year was very bad for him. He had a history of atopic dermatitis, and his well-meaning daughter gave him some herbal medicine to apply, and he burned. So basically, he went around the block, oral steroids, topical steroids, changes in skincare regimen, everything, before he was finally referred to us. Within 20 minutes after the application of reconstituted exosomes, the patient said he no longer felt any burning sensation on his face, and the redness had begun to disappear. And you can see it even at his back. Next slide, please. And he spent a happy Valentine with us. And this photo was taken 4 months after the last application of exosomes. Of course, we had to tell him, don't apply anything else. If you want to apply anything else, let us know first, or else the problem would come back. Next slide, please. And these are my other cases. Lichen simplex chronicus, a patient with COPD, diabetes, and he was overweight, and he's been already through so many things, steroids, changes in moisturizers, microneedling at the depth of 1.5 millimeters, and just 5 times I applied it. 1 week, he's better. And that's also hand eczema, a depth of 0.5 millimeters, 5 times, apply the exosomes, and we're done in 7 days. Next slide, please. And this is a patient that had endometriosis and a wedding to attend. So after 3 sessions, she was ready to say, I do. Next slide, please. And this is another patient. Again, my patients have a tendency to give me deadlines. So the deadline for this patient was 1 week. I made it up to 10 days. So just 1 session with microneedling 5 times with the exosomes, whatever's left in the vial, I sent it home to the patient in an insulated bag, just the way Dr. Duncan did. Excuse me, Dr. Duncan did. Because in my country, we don't have Exobalm readily available. So I just made use of whatever the patient had. And the patient healed. Next slide, please. This is a patient with alopecia areata, but you've seen better pictures with Dr. Inigo. And that patient on your right side, that patient has undergone a series of autologous micrografting. And usually when I do autologous micrografting, I normally see the patients begin to lose their hair at 1.5, 1.7 months. And so this patient wanted a better option. So what you see on the lower side, that's after 4 sessions, that's on the 3rd month. I normally will see that usually in a patient that has had autologous micrografting around the 6th month. And the patient's very happy. Next slide, please. And that is it.
Thank you. Thank you. Those were some great cases. Again, I think what you just saw in the last two, the inflammatory role of exosomes is going to be very important. And maybe we'll develop a drug at some point to be able to actually use these injectable in our part of the world. We're going to have one more talk in this session. It's not in your program. Dr. Gabriel Buendia from Spain is going to come up and talk on his experience as well.
Okay. Thank you so much for having me at the last minute. I just wanted to share with you a special case report of a treatment we did and some experiment we did with a patient. So what happened is we did a really unforgiving CO2 fractional laser on a 53 years old woman that had never had laser procedures done before. Very high energy with a Fraxis CO2 from Meloda. And then we went just crazy and applied exosomes only on one half of the face. We in Europe have the vegetal version from Rosa Damascena that is giving us amazing results. And well, let the pictures talk for themselves. That's 24 hours later. You can really see a clear difference between the side where you had exosomes and the side that didn't have exosomes, both in the bleeding, in the erythema, in how the wound healing is happening, the definition of the microthermal zones and the healthy tissue. Here's some details all over the face. But we can go further. We can see the volume difference because of the edema. The edema is completely different on the exosome-treated side compared to the non-treated side. So that's only 24 hours. And well, the erythema, some more details. Even we can use a pigment analysis to see more clearly the difference between the healthy skin and the scabbing on both the exosome sides and the non-exosome sides. The non-exosome sides look like a mesh. And if we go with the UV fluorescence, we can even see more clearly. You can really see the wounds and the healthy tissue in the deeper layers on the UV side, and you can see a mesh of lesion on the other side. So by the way, a very quick reference for UV fluorescence. Very clear blue is healthy collagen. The bluer it gets, the healthier and younger it is. Grayish blue means elastosis, so it means sun damage. And this kind of yellowish, greenish fluorescence normally is what happens with healing. You have the elastin that has the fluorescence that normally is hidden by the collagen that you can see, pro-collagen. So you'll thank me for this later. So this was day 2, 48 hours after the CO2. Similar to day 1. Apparently, but when we compare on the edema side, it's even more striking. Only 2 days after the making of a savage CO2 fractional laser, almost all the edema has disappeared on the exosome substitute side. And then we changed plans. We went to phase 2, and we applied late exosomes in the other half. We wanted to see what late application of exosomes could do in this lady. Could we still help her or not? So this was a Friday, and we had the weekend happened, and on Monday she came back, and there was a striking difference on the non-treated side now. And we compared the edema, and both sides were equal now. So that's very big news. Even if you, for some reason, are late in the delivery of exosomes, you can still help patients with a very strong anti-inflammatory effects. So this is, I think, the first time you've seen that. And well, the wound healing improved on both sides, but the early delivery was still beating it in terms of falling scabs, improved skin texture. And here you're going to see something very, very new, I think, at least on the image side, it's in the UV. You see, well, you see the yellow the reference. This is the first image I've seen of early onset of neocollagenesis and regeneration caused by the exosomes. The late exosomes delivery side is healing normally, and the immediate delivery is already having elastin and procollagen happening. This is 4 days after the treatment. We let other 2 days happen. So here are some details. Further improvement, almost no more inflammation. Only this is 6 days after the laser. And on the UV side, we have the normal regeneration happening on the late delivery, and way more regeneration happening on the exosome side. So when I think this happened, so the detail, and this is 21 days after the laser. Full recovery of the patient, similar, apparently similar. And obviously there's a big improvement on skin quality and texture, right tides, fine lines. You can have some details here on the improvement. This is the early exosome side treated. Right tides, texture, pores, everything, the texture is widely improved. And on the collagen side, you can see it's bluer now. It's way bluer on the cheek where we had the double pass, and still mildly better on the front. It's not an amazing result, but we still have a collagen improvement. And it also happened on the late delivery side. So we thought, let's compare them. Are the results equivalent? And yes, no. Now, let's compare them. Texture-wise, I think if this wants to move, no? Okay, texture-wise, I think the texture is way more improved in the early delivery side. On the right sides and the pores, both results are good, but the side with the early delivery was still better. Also, the texture, we beat it. And finally, on the collagen side, we can really see that the collagen regeneration is way better on the side where we gave immediate delivery at the exosomes. We have a very homogeneous blue fluorescence, while on the other side you still have some transitory hyperpigmentation, and well, and you can really see the difference here. So giving an immediate delivery of exosomes does the heavy lifting, not only in anti-inflammatory results, like Dr. Rosario said, but also in the homogeneity and amount of collagen that is generated at 21 days. We have to review this patient again next week, so I'll keep you updated about that. So my conclusions are that really delivering the exosomes on immediate treatment improves regeneration, wound healing, neocollagenesis. But if you can't give them immediately, even late delivery exosomes can have a lower but still very good effect. Thank you very much.
Thank you. Thank you for doing that. All right, so we're gonna pass the reins. How about a big hand for all the speakers, and thank you for doing that. And Inigo, you're up. We're gonna go right into part 2 of the lectures. So while Inigo's coming up, you're gonna introduce the group, and we will have a question and answer after this panel. I have it right here.
Well, thank you very much. We're moving to a section where cases are going to be presented. So let me introduce you to Ramon Garcia from Mexico City, Mexico.
I will present the case pediatric oral mucosa and lip tissue regeneration in a Steven Johnson syndrome patient. I'm from Mexico and the Children's Hospital of Mexico, Federico Gomez. We declare there is conflict of interest. And it's a really honor to present this case about a 16-year-old Mexican girl who was affected with the oral mucosa and lips with ulcerations and bloody scabs that affected the oral feeding. She was medical history with epilepsy. She was treated with lamotrigine. 1 week before, she was diagnosed with Stevens-Johnson syndrome and confirmed by biopsy. She received treatment, a standard with immunoglobulin and methylprednisolone for 3 days. Despite the treatment, she persists with pain, ulceration, and blood scabs. For this novel treatment, topical treatment, we use a mixture of exosomes with hyaluronic gel. We obtained the informed consent and ascertainment consent, and the surface area was cleaned with saline solution, and we applied the exosomes and hyaluronic gel in the surface area with sterile swabs twice daily for 3 days. Next day, she was eating. And the third day, this is our result. And this is our result in the 6th day. This is our before and after result. Stevens-Johnson syndrome is an immunological disease, in this case related with medication, that characterized with inflammation, pain, ulceration, and denudated skin. Exosomes and hyaluronic gel treatment was a novel treatment that created a protective barrier, maintaining the exosomes and the surface, improved immunomodulation, and accelerating the repair and regeneration, a distinct concept from the traditional wound healing. These are our outcomes that improve the quality of life of the patients. But in the hospital, there is not the first time we are using exosomes. We are using exosomes in biological dressings, and we want to share this experience. This is in pemphigus flaccus. In this case, it's an ulcerated centrofacial hemangioma. Probably, this is the moment we have to innovate in new products and innovate for new medical devices. For example, hyaluronic gel, biological dressings using these exosomes. Because we need to investment, we need to develop and research. In conclusion, in this case, exosomes and hyaluronic gel treatment was effective and safe for a pediatric patient. Reduce morbidity and enhance the quality of life. However, we need further evidence for effectiveness and cost effectiveness over traditional treatments, because probably the future is today. I want to express my gratitude to Escobayo, Benef, Auvergne Group for this opportunity, and all the health professional work in these cases. Thank you, everyone. 감사합니다. Thank you.
Thank you very much, Ramon. Let me introduce you to Ana Cecilia Amador Ruiz from Mexico City, Mexico. Welcome, Ana.
Hi, good day to all. It's a pleasure to be here with you and having the opportunity of sharing a clinical case with you. I thank to my patient for allowing me to share her case. I'm Ana Cecilia Amador Ruiz from Mexico. I'm family doctor, 12 years and master degree in aesthetic medicine. For the past 2 years, I have been studying and working with exosomes, both for medical and aesthetic purpose. In the 2 scenarios, I have a great result. Allow me to address the dermatitis context. In a clinical dermatology, the term dermatitis is used to describe a variety of different skin disorders that share the same patterns of inflammatory reaction with similar clinical manifestation. This is Danny. Danny is a 30 years old patient with no improvement previous medical history. Start June 2022 with erythema and hands plates on hands, knees, elbows, face, and finally in buttocks. The clinical diagnosis by her dermatology was pityriasis rubra pilaris, such atopic dermatitis, previous treatment with topical steroids with no relevant improvement. This is the result of biopsy of the dermatology. Why I decided to apply exosomes? Well, exosome treatment was based on clinical studies referred to Seung Chon and Irving Duncan articles. These are about the clinical application of exosome in regeneration medicines, anti-aging treatment, and for anti-inflammatory functions. Well, the subcutaneous tissue is the deepest layer of the skin and has fatty tissue and connecting tissue. This layer holds the largest numbers of adipose stem cells in the body, and their exosomes are fundamental for the health and aging of the skin. Anti-inflammatory function inhibit the production of pro-inflammatory cytokines such as TNF-alpha and IL-6, and promote the production of anti-inflammatory cytokines such as IL-10. The treatment history, I used exosome complex, was placed transdermal, 3 sessions, monthly, the first application in September, second application in October, and last application in November. This is the first result. The patient come back after one treatment. It's observed 1 month later the significant decrease in the damaged area. And this is the result the before September and the last photo in November 15. The final result, this photo is taken in August. And the conclusion, the stem cell derived exosomes can be used to treat incurable of very difficult skin disease like dermatitis, psoriasis, scleroderma, skin fibrosis, and so on base of the dual and synergic function and regeneration and anti-inflammatory. Hansamina.
Thank you very much for this extraordinary result, Anna Cecilia. Let me introduce you to Julia Tvarani Oshia. She's from Dublin, Ireland. Welcome, Julia.
Thank you, everybody. Thank you, everybody. I would like to do a marathon slide here. Okay. So your hair is your crown and glory, the crown you never take off. So this will be the list of patients I've treated. So yes, you can see the first picture showing that it is a medical doctor actually on 2 oral medication, finasteride and minoxidil, but nothing changed. As you can see, only 1 treatment of exosome gives such glowing hair, healthy scalp, and hair growth. So the next one is, you can see the thinning of the hair overall, but after 1 treatment, very quick, 12 weeks apart. This is a young chap with obviously receding hairline and also a bit of dermatitis at the crown area. Just after 1 treatment, you can see how healthy and fluffy. Obviously, the fiancé is very happy. So this is just showing you the crown area. You can see how healthy the hair at the same place, same lighting, and you can see the color of the hair improve. So this is just to show you the hairline and also the texture of the hair. This patient has psoriasis. As you know, in Dublin, island, Celtic skin, and they are prone to autoimmune and inflammatory skin and scalp condition. So I treated him. This would be 9 weeks post first treatment, and so far he had 2 treatments. You can see even the frontal area, the hairlines has improved. So this is another friend of mine who's a pharmacist. As you can see, overall improve of hair texture and color as well as hair growth. So this is a lady with psoriasis as well. You can see that after 1 treatment, the hair has grown, and then you can see the texture and the color of the hair improve as well. So just for testing, basically he's my father-in-law. So just trying to see whether the Exosome works for his age. He's about almost 70. You can see the thickening of the hair only after 12 weeks from the first treatment, and so far he had 2 treatments. So frontal fibrosing alopecia, I think Dr. Inigo has covered clearly. And so this patient already had all the cocktails given by her dermatologist 10 years ago. So came to me and I decided to do the Exosome treatment. As you can see, like only 4 weeks post first treatment, and she's very happy. This shows the quality of the hair. You can see she got her shine back and also her natural curl. And if you focus closely, this is before her 3rd treatment. The slide over there, you can see that baby hair is growing over her actual hairline. So filters are great, but great skin is better. Here we glow with Exosome. So as you can see here, rosacea improved. Not only that, you can see like focus over her jawline. There's a bit of lifting effect, and she's very happy just after first treatment. So this is another lady with very sensitive skin. I call this microneedling Exosome treatment as a red carpet treatment, because you can see that she have a really red face after I done about 1.5 to 2 millimeter depth of microneedling. Look at her the next day, flawless. So this lady has been suffering from acne because she has PCOS, and she was on metformin, and she's getting married soon, so I decided to do the Exosome. And also she was given Exobalm and also cell treat skincare. So only after 1 treatment, as you can see, the scar improved. You know, it's very common in this skin tone group, they can get PIH. So the earlier you treat, the better the outcomes. As you can see, she told me before she started the Exosome treatment, she decided to stop her metformin. And guess what? Her LH FSH ratio has normalized. So I think Byung-Chul should investigate further. It could have, it could be the effect to the body, the Exosome. So I just skip this. This is myself. I developed atopic dermatitis. I've tried all the topical treatment, including tacrolimus. No effect, and after 1 session of microneedling with Exosome. Amazing. So no high-tech treatment, no fuss. All I need is the magic cream, which is the Exobalm. So this will be the list of patients I treated. So this patient has melasma and also rosacea. So I need to treat the rosacea first before I move on to melasma. As you can see, 1 week after Exobalm. So the last case will be dermatomyositis. This patient has been suffering from a skin condition for years and only diagnosed 3 years ago by one of the dermatology. And as usual, they treat with steroid, first-line cocktails, but nothing really improved. Look at him, just using Exobalm 2 weeks later. Happy man, happy wife. So, in this case, I couldn't do microneedling because there's so many broken skin, but look at him at 4 weeks. I think his skin look better than mine. I'm very happy, and he's continued to improve. So I actually maintained him with the firming cream and also the other cell treat product. So this is the wife. So a short message.
Appreciate.
What was the message?
Sorry.
Of the wife?
Yeah.
Okay. What did she say?
Look, just to say thank you. We appreciate what you sent us, and I suppose there's more appreciation for the skin as it has improved so much. I mean, we're years and years
going to dermatologists, and nothing as recently as about 2 months ago, and nothing could be wrong that he was happy with ever. So thanks again.
Thank you everyone for your
Thank you very
attention.
much,
Have a
Julia.
lovely evening.
Thank you very much, Julia. It's interesting, you noted a change in the pigmentation of hairs after the treatment. So let me introduce now to Dr. Ali Alamri from the Kingdom of Saudi Arabia. Welcome, Dr. Alamri.
Thank you so much. They informed me that the time is short, so I try to pass over all these slides. So actually, I'll not go through all slides, but okay. It's too late. Yes. So understanding the pathophysiology, and I find it's the gold standard to get the optimal result. So I'll go down to the clinical experience. So we find some protocols in our background. So when we mix the ASCII with PRP or ASCII with Regeneron, we find a good or excellent result in the androgenic alopecia. So also in skin rejuvenation and scars, when we mix the ASCII with drug delivery system by radiofrequency microneedling or CO2 laser, we find also the best result in our cases. ASCII phase plus hyaluronic acid or tranexamic acid also work excellent with the pigmentation and post-inflammatory hyperpigmentation. Actually, we apply also the ASCII in preocular dark circle and in cosmetic gynecology. I find the best word in the use of ASCII in skin texture is regeneration instead of rejuvenation. We find some protocols to distribute the ASCII over some micro-injected points in distance in every 1 month, and about 2.5 ml per session, and we find improvement in the skin texture, as you see here, the fine wrinkles. In the next case, you'll find also improvement in around the dark circle eyes and also nasolabial fold, as you see here in this case. What you will find if you inject the micro points of the ASCII, you will find in the first week a good hydration, and after 1 month you will reduce wrinkles and pores, and after 1 month you will find increase in volume also and skin texture. My protocol in around the eyes, I mix 1 ml of ASCII with 1 ml normal saline or hyaluronic acid, and I find excellent result after 3 sessions. So as you find here, before and after. And also this case is actually a difficult case to treat with hyaluronic acid alone as filler, and I find the excellent protocol as I mentioned before. Androgenic alopecia, you know, it's a challenge to treat with topical, so this case I mix the Exosome with Regeneron, and the result, as you see, after 1 session, good improvement. This case, I mixed the ASCII with PRP, Magellan, and this is after 2 sessions. As you see here, I only use ASCII injection, micro injection, and the result after 1 session. As you see here, after 2 sessions, and here after 2 sessions, here after 3 sessions, you see improvement. We change also the texture and color. As you see here, the big improvement between the two cases, and this case is telogen effluvium, and the result after 3 sessions. This is also androgenic alopecia for female after 1 session. I will pass over another indication, surgical and acne scar. I think we have to use the drug delivery system, as my colleague mentioned before, to use the CO2 laser or radiofrequency. As you see here, the drug can go deeper and get more benefit. So in this case for acne scar, I did CO2 laser and I apply only as film of ASCII and the result after 2 weeks. And this case again, I have no more time, so I have to pass over this patient after trauma, and this is after 2 sessions. We can find improvement for hyperpigmentation also to apply the ASCII with radiofrequency. This also brachoplasty scar, and this is after 2 sessions. This one also after 4 sessions, and this one after 4 sessions. And here, as you see, the first session and the second session. This is also another case. Here, inflammatory disease, actually, I find excellent result with the lichen planus in the scalp after 1 session. Here, alopecia areata, you will see a video for this patient has allergy against the prednisolone and an steroid, so I inject him alone with ASCII. This is the improvement after 4 sessions. This is active acne, and I use the microneedling radiofrequency with ASCII as film. And this case also the same. Hypertrophic scar and burn, I find this excellent result also because we try to avoid the hypopigmentation and atrophy after injection of the steroids. So I mix the Conolog with the ASCII, and you see the result in the other side. This case is baby with burn, and I apply the ASCII, and this is the result after 3 days, only 3 days. This is also old burn scar, and I treat her with ASCII and CO2 laser. Dark circle, again. And this is the conclusion, the combination with other treatment, I find it the optimal treatment. Thank you so much.
Thank you very much, Ali. I mean, they are amazing cases. We all learn from this. I will try in the same indications. Thank you very much. Are you from Jeddah or Riyadh?
Riyadh.
Riyadh, okay.
Yeah.
I've been there several times. Well, thank you very much. Let me introduce now to Dr. Victoria Bello. Victoria, please welcome to the podium from the Philippines. Victoria has 13 big clinics in Manila, right? 12 of them are in Manila. And I've seen their organization, and I was blown by the efficacy and the efficiency of 600 people you have working for you, and with amazing results. So please, Victoria.
Thank you, Dr. Inigo, and thank you, Dr. Michael Gold. These two are my mentors. They've taught me a lot. Our clinic has been around for 33 years. I started when I was 10 years old, you can tell. Now, anyway, we have 60 doctors with us and 600 people. So we have 3 cases to present, these that were done by our doctors. Is this great? Okay, here we go. Next. Oops, sorry, here I'm getting. So our first case is a combination treatment of exosomes and a 589 vascular laser for the treatment of psoriasis vulgaris. So she's a 35-year-old female. She has a known case of psoriasis vulgaris since she was in her childhood. There were no treatments. You know, she tried a few psoriatic treatments, but she felt they weren't working, so she only puts argan oil to soothe the itchiness and the scaling. And then she came to our clinic and we applied. We did 2 sessions of the Advalite, the 589 laser, a vascular 1,000 shots, and then photos were taken when we started before and 1 week after the second session. The sessions were 2 weeks apart. The patient tolerated the treatment very well and no side effects were noted. So here we have a picture of the right leg and the left leg with the psoriasis. And here he is after 2 sessions of 2 Advalite treatments and the application of exosomes after every treatment. So there were 2 applications of exosomes, ASC, exosomes. Conclusion, treatment combination of exosomes and a vascular laser reduced redness, itchiness, and scaling of psoriasis vulgaris. Next slide. Exobalm, the second case is, so the first case was by Dr. Jack Luna. The second case is by Guada Capris, I think. So Exobalm is monotherapy for non-healing post-surgical wound treat due to hidradenitis suppurativa. So we have here a 24-year-old female who was diagnosed with hidradenitis suppurativa 4 years before coming to us. She had multiple recurrent painful nodules, abscesses, and draining sinus tracts on both armpits, inguinal areas, and the nape of the neck. On September 2022, the patient underwent surgical excision of the ulcerated sinus tracts on her right arm, because that was the most malodorous and the most serious one. And then it was left to heal by secondary intention. Topical antiseptics and antibiotics were applied as well as oral antibiotics. But the wound remained open for 8 months. And this is when she saw treatment at Bello with Dr. Jack Luna. So week 1, here we are before applying the exosomes. It was Exobalm. So we only got, we had very little Exobalm at that time. She only got 1 jar, which is supposed to be finished in about 2 weeks, but she used it for 7 weeks. Very little, she really tried to save the balm for 7 weeks. So here we are at week 1, and at week 3, you can see already there's some closure of the wound. And at week 6, it's shrinking. At week 7, here we are, it's almost totally closed. And here she is at her right armpit. So 8 months of an open wound, and 7 weeks it closed. So the conclusion would be that monotherapy treatment, so there's no antibiotics or anything, with Exobalm is effective in the treatment of non-healing wounds. The third case is the management of radiation dermatitis in a breast cancer patient with Exobalm. So we have here a 48-year-old female diagnosed with invasive breast cancer on the right side. She went under lumpectomy on June 2023, and then she did radiation every day for 30 days. That resulted in a lot of blistering and post-inflammatory hyperpigmentation. Exobalm was started after her 30th day of radiation. Past medical history, she underwent the same treatment in 2015, where she also underwent 30 days of radiation, and it took 3 months of emollients for her post-inflammatory hyperpigmentation to resolve, but the scar was still thick. So this time we started Exobalm the day after, and here we are on day 1. As you can see, there's thickening around the nipple of the scar and very marked post-inflammatory hyperpigmentation. At day 20, after applying Exobalm, you can see that the PIH is much better and the scar is much flatter. And this is day 35 follow-up, and you can see resolution. A lot of the hyperpigmentation has disappeared, and the scar is much flatter. So the conclusion is almost complete resolution of hyperpigmentation and improvement of thickened skin and surgical scars. So I'd just like to thank Exosomes and beyond for introducing us to this product. In 33 years, I think There have been things that have revolutionized my practice, and this is definitely one of the biggest things that has happened to us. And I am so excited to come here every year to see even more uses for Exosomes. Kamsahamnida. Thank you.
Thank you very much, Victoria. Amazing cases. Because we're running out of time, we're going to reduce the 20-minute time that we had for questions and answers to 5 minutes. Can you bring 4 chairs, please? And I would like to invite Jan, Michael, Renato, and Rosario. Please come up here to the stage so that we can... is there anyone in the audience wanting to make a question? There's a microphone there in the center. Take this opportunity because we won't have much time for questions. Is there anyone wanting to make a question? Yes. Please, can you tell us your name and who you want to make a question
Hello.
for?
Can you hear me?
Hola, hola, hola.
Yeah, hi, I'm Dr. Nami from Lebanon. I'm a dermatologist. And first, I would like to ask about the half-life of reconstituted exosomes, because I would like to ask a further question once I know the answer. I don't know whom to address this question to.
The half-life of reconstituted, maybe Bjorn wants to answer that question.
Half-life of reconstituted exosomes.
Okay, thank you for your question. After reconstitution, our official recommendation is immediate use, less than 3 hours. Yeah.
Okay, in that case, I would like to ask Dr. Rosario, how did she reconstitute all the vials for her patient and send him home with it to use for a period of 7 days? Or
Yes,
yeah,
that's
10
very
days.
easy. There is a diluent that accompanies the exosome. So I just reconstituted it in front of the patient and the family or the accompanying person. And then I applied it, showed them how to do it. And I have in my clinic, because we don't have Exobalm readily available, I have in my clinic a lot of insulated bags and ice. And I sent it there with strict instructions to put it in the ref and then come back within a week.
Yeah, but the answer was the exosomes lose
Yes.
lose their
Correct.
capability after like 1 hour or so.
Correct. However, I'm following what Dr. Duncan did for her patient. And so based on her experience, I just followed that because my country is very poor and we try to do what we can.
Well, with
And it
What I mentioned is that to keep the best potential, 100% potential is 3 hours, we recommend. But definitely after that, slowly, some molecules will be degraded, right? So
sure.
3 hours is the best
Is the
potential.
optimal time. So also I have one more question. What is the constituent of exobalm and exomask? And would you recommend that after a procedure, or would you recommend the reconstituted vials? Which is more potent after like microneedling or whatever? If we have both in our country, what would you recommend? Thank you. That's all I have.
Thank you. In your clinic, for example, post-laser treatment, in your clinic, we can recommend the reconstitution, ASE Plus. It's the flagship product, but the Exobalm you can apply once at your clinic, and your patient are supposed to take them to their home for up to 3 weeks. Yeah.
But what do they contain? What is like the number of exosomes in the balm?
The number of exosomes is the same
Yeah.
between the two products. The particle number is the same, but the formulation is very different, actually.
Thank you.
Thank you.
Thank you.
We're going to ask one question per person so we can have more diversity in the questions, please.
Anyone would like to make any other question? Can I make a comment? Because Exobalm is also reconstituted, and I think that the indication is 1 month. Is that correct?
1 month.
It's up to 3 weeks now. Yeah. After reconstitution, you keep in the refrigerator for 3 weeks.
Okay, please.
Hello, Jackie Lewis from London, plastic surgeon. Can you please tell me if the Exobalm contains rose-derived exosomes or human-derived exosomes? Thanks.
You have 2 options, actually. You have 2 versions. So it's about regulatory issues. So in your country, rose stem cell exosomes, actually. But in the US, human stem cell exosomes.
All right. Any other questions? Yes.
I'm Dr. Lin from Taiwan. I have an interesting question because we learn the repigmentation by exosome, but we also know that the exosome can treat melasma. Is there any conflict between these two concepts, repigmentation and depigmentation?
That's a very good question. Well, I had the same question. I made the same question to myself. How can exosomes reduce hyperpigmentation and treat melasma, and at the same time can induce pigmentation or recovery? So the fact is that both things happen. So there must be two different mechanisms molecularly, right, to explain that. And in fact, I have an idea. I think that the way we can recover the pigment of a hair is through that pathway that I comment, the programmed cell death, right? And at the same time, if we manage to reduce the pigmentation of melasma, it is because of some microRNA that is inside. So I remember that these days, studying about this, keratinocytes have also contained microRNAs that enhance pigmentation and that reduce pigmentation. The same exosomes of a keratinocyte, I'm not talking about exosomes of adipocyte stem cell derived. So both things happen at the same time, very probably because the mechanism is different. And these are facts. We don't know the real answer. I'm not a molecular biologist like Jean-Pierre, but I think that we've seen a reduction in pigmentation with melasma. We've seen a recovery of color in hairs.
Thank you so much.
Thank you. Is there anyone would like to make any comment about this?
I mean, one of the things we know whenever you take an energy-based fractional device, whether it's CO2, non-ablative, microneedling is really a fractional device of some kind. Those devices by themselves cause repigmentation in hypopigmented areas, and they also cause reduced pigment in hyperpigment areas. And so again, I think to me, the exosomes are just aiding both of those processes because again, of the wound healing cascade that we know that this plays a role in every part of. So again, I don't think any of us understand all the mechanisms because we surely don't understand it why in fractional lasers, hypopigmented pigment and hyperpigmented go back to normal skin color. So we just have to keep learning and keep studying.
Great. So I'm Shazia Ali from Jeddah, Saudi Arabia. So I hear that over 1 million cases have been treated with the exosomes. It's great science. We have some amazing cases that we've seen. I was just wondering that are there any reported side effects out of all of those 1 million cases? Because I know this is amazing and we are looking at all the good stuff. Let's look at the other side of the coin also. Are there any reported side effects in the million cases?
So I'm not aware of any with these exosomes. I'm aware of lots of infections and other things for some other plant-derived exosomes in the United States. I'm not aware of any. And if you had any, so again, I think it's if it's a drug, there's ways to monitor side effects. We have to report those, right?
Yeah.
As clinicians and companies if they get in. So I'm not sure that is the same case here, at least in our world. So have you had any reported?
Before I answer, do you have any comments on the side effects? Bello or Cherry, can you share any experience on side effects?
Sure. This is the one that I reported a while back, that some of our patients in the Philippines experienced some stinging upon the application of ASCE, although the majority of the patients will experience soothing relief from almost instantly, within 20 minutes. So these are a few random cases. So we reported them. And I also reported that in some of our patients, we had transient cervical lymphadenopathy that was seen after microneedling of the scalp. So these are basically some of them. And then there was last night, I attended a webinar by Sci Asia, and there was a physician who reported that he had seen the granuloma formation that happened after the Benev product was injected into an area. Sir?
Actually, I don't think it's true, but okay. From our almost 1 million cases, when we applied our product topically or in a very minimal invasive way or in combination with the energy-based device, there was no report, something like that. But some doctors sometimes inject, I believe, and then they could see some allergies or something like that. But one thing is that exosomes themselves are, I believe that they are very safe. They came from our stem cells. Always, our cells are releasing exosomes in our bloodstream, and they are exchanging information. So exosomes themselves are very safe, but sometimes maybe other ingredients might cause allergy, just like normal skin boosters, like NCTF, something like that. HA sometimes cause allergy. That kind of allergy could be seen by using our finished products.
Yeah, it's very interesting. I think the journey has just started, and we are going to see both sides of the coin as we move forward, but it's super exciting. Another just question, because while we were touring the factory, they were telling us that we are maintaining a cold chain and we are keeping the exosomes at a certain temperature. And now that we are combining with energy-based devices, so the skin temperature might be raised when you're doing fractionated CO2 or BMYAG or any of those devices, or RF for that matter. So when you're applying them to the heated skin, do we lose some of the exosomes while we see some of the results which are from the remaining ones, but do we lose some product in the process because of the heat? Any ideas?
Yeah, in our acne scar publication, which is a double-blind one, they after laser treatment, they waited for about 20 minutes to cool down. It must be like that to be more effective, I think.
Okay, we're going to take 3 more questions.
Just a very quick comment there. I think if the skin takes the heat, exosomes are part of the skin and the tissue, then the vesicles from the product should also be able to take the heat. That's just my guess.
Interesting to know, though, exactly what happens.
Thank you.
Dr. Subaru.
I'm Suparut from Bangkok, Thailand. I would like to ask Mr. Cho some of the questions, but don't be angry with me. Okay, first you mentioned that ACE should be used for 100% efficacy within 3 hours, right? But you mentioned that exobalm at the same source of the exosome can last for 21 days, 3 weeks. So if we store the exosome in the refrigerator and keep the control of the temperature, so we can use it for 21 days, like exobalm, right?
Yeah, it's,
thank you.
Thank you for your question. And so exobalm is a kind of a different formulation. It's cream type formulation. So it's maybe it may lose more potency than ASE because it should be kept. But our recommendation is a week. But people, doctors and patients want to use exobalm longer in a longer time. So and the amount of the cream would be like can be used for 3 weeks. But our official recommendation is fast use actually, because they might lose their potency in the refrigerator while being kept in the refrigerator.
Would you share the information if we store the ASCE exosome more for 24 weeks? What is the potency of them will decrease from 100?
Okay, we have internal data. The data came from one of our professors about 4 years ago. Okay, I will share the data with you later.
Okay, thank you. Next question, please.
Hi, good afternoon to everyone. I'm Dr. Suzanne Twin from the Philippines. I have 2 questions for Dr. Val or anybody who can answer. The first is, because of all the products available in the market now, number 1, is there a minimum number of particles for the exosome product to work? Maybe 2 billion, 5 billion, 10 billion. And number two, is there a saturation point where after putting so much exosomes, the results maybe begin to plateau, or you won't see any results anymore after that?
So I'll answer the second question first. There's always a plateau of pharmacology, right, where you stop seeing additional effects. It's basically you have a dose response curve and then you don't see an additional effect. So that would also be true for exosomes, I'm sure. The other question was regarding the number of particles. Now this is really very important. Particles doesn't mean exosomes. Particle means there's something counted by a nano-tracking analysis device that is approximately up to 200 nanometers large in the solution, in the preparation. That doesn't mean that those are exosomes. Yeah. So if you, for example, you mentioned plant products, if you take mango or something and put it in a mixer and create nanovesicles out of that, there's a lot of other stuff that is present in that exosome isolate. So you shouldn't say that you need 5 times 10 to the 9, 5 billion, or 20 billion, or 8 billion. Depends on the quality of the vesicle.
So because there are different sources now, of course we have adipose tissue, we have bone marrow, umbilical cord. Do the number of exosome particles matter?
The quality is much more important than the number that's on the bottle. All right. Quality is everything, actually.
So I get what you're saying, because there are companies out there that you may have 5 million and they have 8 million, and somebody I know says they have 20 million and billion. And what do you need 20 billion, right? If the quality is not right. And if you have 20 billion irregular particles or or not the right quality, we as the clinicians have really no way to figure this out yet. So we rely on you guys to help us.
Yeah, so what's probably needed is, I'm not in the business of comparing different products and their quality and their functionality, but that should probably be done in one way or another. It's probably difficult if one manufacturer compares all the different products, probably better than somebody independent does, right? So some sort of functional anti-inflammatory effect would be good to compare, I think.
Okay. Thank you,
Well,
doctors.
thank you very much. We are running 35 minutes late. So may I suggest, if there's any more questions, please, I would encourage you to make the questions directly to the speakers. Thank you very much for this panel, has been great. And we can restart 10 minutes to 7, all right, at 18:50, okay? See you.
We're actually going to have 45 minutes, I'm sorry, and I appreciate your patience today. So we're going to have 45 minutes for dinner. It's going to be here inside of the room, so if you need to go to the toilet, you can quickly go and come back, and there you're going to have your dinner served in your tables.
Now we've realized that we don't actually have to take the cells, we can actually take the exosomes, which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing.
So what we found was that these exosome treatment was far better and much more efficient than any other treatment that we've tried before.
And the ASC had such a big improvement in her rosacea and overall in her quality of life. It just rejuvenates the skin so well, better than anything else on the market at the moment.
I even recently had a patient who is in her 70s. She had had unremitting shingles with open sores for 3 months. I gave her some exosome balm, and they were all healed up in a week, and she had no more pain.
Exosomes is probably the only exosome company that has built a GMP facility for the purpose of manufacture their own product.
So that is really developing the next generation of exocobio, exosome-based medicines for more severe diseases.
Exocobio was built to help people stay younger and healthy. Exocobio is the global exosome leader, providing hope and a mean for your future.
Exocobio. Our exosomes, your future.
저나 다른 분들이 노화되는 과정에서 많은 질병에 걸리고 삶의 질이 떨어지는 것을 확인할 수 있었습니다. 저는 조병성이라고 합니다. 엑소코바이오 설립자이며 대표이사를 맡고 있습니다. 엑소코바이오는 줄기세포 엑소좀에 집중을 하고 있습니다. 엑소코바이오 개발한 엑소좀 제품은 근본적인 피부 노화, 학력, 재생 등을 동시에 효과적으로 할 수 있는 새로운 기술입니다. 엑소좀은 크기가 100나노미터 정도 되는 아주 작은 사이즈의 베지클입니다. 사람들 간의 교신을 할 때 모바일 폰이나 그 안에 있는 채팅 앱을 이용하는데 중요한 정보들을 담아서 보내는 것이죠. 근데 우리 몸 안에 있는 세포들끼리 그런 정보를 담아서 보낼 때 엑소좀을 이용하는 것입니다. 그 줄기세포 엑소좀 기술이 미래에 가장 유망한 재생의료 내지 재생의학 기술이 될 거라고 생각을 했습니다. 그래서 이 분야의 그 기술을 사업화하기 위해서 엑소코바이오를 설립하게 됐습니다.
The idea or the concept behind exosomes is that we're sending a cell signal, and we don't need the cell at all. We just really need the message. My name is Diane Duncan. I'm a board-certified plastic surgeon. I own Plastic Surgical Associates here in Fort Collins, Colorado. Exosomes are not alive. So I would think the basic explanation of how an exosome works would be that it sends out a signal to a regional or neighboring cell, and it tells that other cell or system to do something. What it usually tells the cell in the areas that we work with in the aesthetic industry is for healing of skin and for stimulation of structures that live within the skin or the dermis, such as growth of new blood vessels, growth or stimulation of collagen formation. So I think there's a really giant variety of things, and I think we're really only scratching the surface of what exosomes can do. How exactly exosomes work, I think they're still a little mysterious to us. An exosome is going to give a cell a message depending on the proteins, the message that the RNA has. All exosomes are not the same. They're different depending on their source of origin. But they will tell the cell to do something. The potential of these cells is really what has me interested in them, because if you can target them, say for certain types of skin cancers or neurologic cancers, even kidney cancers, if you target exosomes to give your T cells, which are immunologic cells, you can induce a cytotoxic response in a tumor cell to make it give itself the message to kill itself. Now, most of the cultured exosomes are derived from conditioned media. And one of the problems with conditioned media, though, is that some of those contaminants are still in the product.
대부분의 그 엑소좀을 분리정제하는 기술은 초고속 원심 분리라는 아주 전통적인 방식입니다. 근데 그 방식은 엑소좀이 분리 과정에서 깨지는 현상이 있었습니다. 이런 점을 저희가 특별히 주목하고 지난 4년 동안 엑소좀을 대량 생산하고
Everyone, the dinner is being served in your tables, so please sit down so you can have dinner. So please sit down, everyone, in your tables so you can have dinner. It's being served in your own tables where you were. At the end of the night, we're going to have a cocktail party, so you're going to have more time to socialize there. So please come back to your tables and quickly have dinner.
Selfie with you.
Yes.
What?
Send it to me.
What?
Send the picture.
Oh, seriously? Okay. How can I send you airdrop?
No,
Airdrop.
WhatsApp.
I don't have.
Kakao.
You iPhone? No.
I want to ask everyone to please sit down in your own table so you can have dinner. Otherwise, we're going to be even more late for the event. You feel like
Now we've realized that we don't actually have to take the cells, we can actually take the exosomes which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing.
So what we found was that these exosome treatment was far better and much more efficient than any other treatment that we've tried before.
And the ASC had such a big improvement in her rosacea and overall in her quality of life. It just rejuvenates the skin so well, better than anything else on the market at the moment.
I even recently had a patient who is in her 70s. She had had unremitting shingles with open sores for 3 months. I gave her some exosome balm and they were all healed up in a week. And she had no more pain.
Exosomes is probably the only exosome company that has built a GMP facility for the purpose of manufacturing their own product.
So that is really developing the next generation of exosome-based medicines for more severe diseases.
Exobio was built to help people stay younger and healthy. Exobio is the global exosome leader, providing hope and a mean for your future.
Exobio. Our exosomes, your future.
저나 다른 분들이 노화되는 과정에서 많은 질병에 걸리고 삶의 질이 떨어지는 것을 확인할 수 있었습니다. 저는 조병성이라고 합니다. 엑소코바이오 설립자이며 대표이사를 맡고 있습니다. 엑소코바이오는 줄기세포 엑소좀에 집중을 하고 있습니다. 엑소코바이오 개발한 엑소좀 제품은 근본적인 피부 노화, 학력, 재생 등을 동시에 효과적으로 할 수 있는 새로운 기술입니다. 엑소좀은 크기가 100나노미터 정도 되는 아주 작은 사이즈의 베지클입니다. 사람들 간의 교신을 할 때 모바일 폰이나 그 안에 있는 채팅 앱을 이용하는데 중요한 정보들을 담아서 보내는 것이죠. 근데 우리 몸 안에 있는 세포들끼리 그런 정보를 담아서 보낼 때 엑소좀을 이용하는 것입니다. 그 줄기세포 엑소좀 기술이 미래에 가장 유망한 재생의료 내지 재생의학 기술이 될 거라고 생각을 했습니다. 그래서 이 분야의 그 기술을 사업화하기 위해서 엑소코바이오를 설립하게 됐습니다.
The idea or the concept behind exosomes is that we're sending a cell signal and we don't need the cell at all. We just really need the message. My name is Diane Duncan. I'm a board certified plastic surgeon. I own Plastic Surgical Associates here in Fort Collins, Colorado. Exosomes are not alive. So I would think the basic explanation of how an exosome works would be that it sends out a signal to a regional or neighboring cell, and it tells that other cell or system to do something. What it usually tells the cell in the areas that we work with in the aesthetic industry is for healing of skin and for stimulation of structures that live within the skin or the dermis, such as growth of new blood vessels, growth or stimulation of collagen formation. So I think there's a really giant variety of things, and I think we're really only scratching the surface of what exosomes can do. How exactly exosomes work, I think they're still a little mysterious to us. An exosome is going to give a cell a message, depending on the proteins, the message that the RNA has. All exosomes are not the same. They're different depending on their source of origin. But they will tell the cell to do something. The potential of these cells is really what has me interested in them, because if you can target them, say for certain types of skin cancers or neurologic cancers, even kidney cancers, if you target exosomes to give your T cells, which are immunologic cells, you can induce a cytotoxic response in a tumor cell to make it give itself the message to kill itself. Now, most of the cultured exosomes are derived from conditioned media. And one of the problems with conditioned media, though, is that some of those contaminants are still in the product.
대부분의 그 엑소좀을 분리정제하는 기술은 초고속 원심 분리라는 아주 전통적인 방식입니다. 근데 그 방식은 엑소좀이 분리 과정에서 깨지는 현상이 있었습니다. 이런 점을 저희가 특별히 주목하고 지난 4년 동안 엑소좀을 대량 생산할 수 있는 일종의 그 필터링 기술을 개발을 해서 엑소좀 하나하나의 그 품질을 유지할 수 있는 데 성공을 했습니다. 엑소코바이오가 개발한 그 순수한 엑소좀을 가지고 향후에는 재생의료나 항암제 분야로 뛰어들 것을 목표로 하고 있습니다. 엑스코바이오의 비전은 글로벌 엑소좀 바이오텍 기업이 되는 것이고, 엑스코바이오가 향후 5년간 1,000억 원 정도의 임상이나 신약 개발에 투자를 하려고 하고 있습니다. 그 결과가 성공적이 되면 전 세계 난치성 질환 환자들에게 큰 도움이 될 걸로 예상을 하고 있습니다.
Now we've realized that we don't actually have to take the cells, we can actually take the exosomes which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing.
So what we found was that these exosome treatment was far better and much more efficient than any other treatment that we've tried before.
And the ASC had such a big improvement in her rosacea and overall in her quality of life. It just rejuvenates the skin so well, better than anything else on the market at the moment.
I even recently had a patient who is in her 70s. She had had unremitting shingles with open sores for 3 months. I gave her some exosome balm and they were all healed up in a week. And she had no more pain.
Exosome is probably the only exosome company that has built a GMP facility for the purpose of manufacturing their own product.
So that is really developing the next generation of exosome-based medicines for more severe diseases.
Exosome was built to help people stay younger and healthy. Exosome is the global exosome leader, providing hope and a mean for your future.
Exosome, our exosomes, your future.
저나 다른 분들이 노화되는 과정에서 많은 질병에 걸리고 삶의 질이 떨어지는 것을 확인할 수 있었습니다. 저는 조병성이라고 합니다. 엑소코 바이오 설립자이며 대표이사를 맡고 있습니다. 엑소코 바이오는 줄기세포 엑소좀에 집중을 하고 있습니다. 엑소코 바이오 개발한 엑소좀 제품은 근본적인 피부 노화, 항염, 재생 등을 동시에 효과적으로 할 수 있는 새로운 기술입니다. 엑소좀은 크기가 100나노미터 정도 되는 아주 작은 사이즈 베지클입니다. 사람들 간의 교신을 할 때 모바일 폰이나 그 안에 있는 채팅 앱을 이용하는데 중요한 정보들을 담아서 보내는 것이죠. 근데 우리 몸 안에 있는 세포들끼리 그런 정보를 담아서 보낼 때 엑소좀을 이용하는 것입니다. 그 줄기세포 엑소좀 기술이 미래에 가장 유망한 재생의료 내지 재생의학 기술이 될 거라고 생각을 했습니다. 그래서 이 분야의 그 기술을 사업화하기 위해서 엑소코 바이오를 설립하게 됐습니다.
The idea or the concept behind exosomes is that we're sending a cell signal and we don't need the cell at all. We just really need the message. My name is Diane Duncan. I'm a board certified plastic surgeon. I own Plastic Surgical Associates here in Fort Collins, Colorado. Exosomes are not alive. So I would think the basic explanation of how an exosome works would be that it sends out a signal to a regional or neighboring cell, and it tells that other cell or system to do something. What it usually tells the cell in the areas that we work with in the aesthetic industry is for healing of skin and for stimulation of structures that live within the skin or the dermis, such as growth of new blood vessels, growth or stimulation of collagen formation. So I think there's a really giant variety of things, and I think we're really only scratching the surface of what exosomes can do. How exactly exosomes work, I think they're still a little mysterious to us. An exosome is going to give a cell a message depending on the proteins, the message that the RNA has. All exosomes are not the same. They're different depending on their source of origin. But they will tell the cell to do something. The potential of these cells is really what has me interested in them, because if you can target them, say for certain types of skin cancers or neurologic cancers, even kidney cancers, if you target exosomes to give your T cells, which are immunologic cells, you can induce a cytotoxic response in a tumor cell to make it give itself the message to kill itself. Now, most of the cultured exosomes are derived from conditioned media. And one of the problems with conditioned media, though, is that some of those contaminants are still in the product.
대부분의 그 엑소좀을 분리정제하는 기술은 초고속 원심 분리라는 아주 전통적인 방식입니다. 근데 그 방식은 엑소좀이 분리 과정에서 깨지는 현상이 있었습니다. 이런 점을 저희가 특별히 주목하고 지난 4년 동안 엑소좀을 대량 생산할 수 있는 일종의 그 필터링 기술을 개발을 해서 엑소좀 하나하나의 그 품질을 유지할 수 있는 데 성공을 했습니다. 엑소코 바이오가 개발한 그 순수한 엑소좀을 가지고 향후에는 재생 의료나 항암제 분야로 뛰어들 것을 목표로 하고 있습니다. 엑소코 바이오의 비전은 글로벌 엑소좀 바이오텍 기업이 되는 것이고, 엑소코 바이오가 향후 5년간 1,000억 원 정도의 임상이나 신약 개발에 투자를 하려고 하고 있습니다. 그 결과가 성공적이 되면 전 세계 난치성 질환 환자들에게 큰 도움이 될 걸로 예상을 하고 있습니다.
Now we've realized that we don't actually have to take the cells, we can actually take the exosomes which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing.
So what we found was that these exosome treatment was far better and much more efficient than any other treatment that we've tried before.
And the ASC had such a big improvement in her rosacea and overall in her quality of life. It just rejuvenates the skin so well, better than anything else on the market at the moment.
I even recently had a patient who is in her 70s. She had had unremitting shingles with open sores for 3 months. I gave her some exosome balm and they were all healed up in a week. And she had no more pain.
Exosome is probably the only exosome company that has built a GMP facility for the purpose of manufacturing their own product.
So that is really developing the next generation of exosome-based medicines for more severe diseases.
Exosome was built to help people stay younger and healthy. Exosome is the global exosome leader, providing hope and a mean for your future.
Exosome, our exosomes, your future.
저나 다른 분들이 노화되는 과정에서 많은 질병에 걸리고 삶의 질이 떨어지는 것을 확인할 수 있었습니다. 저는 조병성이라고 합니다. 엑소코바이오 설립자이며 대표자를 맡고 있습니다. 엑소코바이오는 줄기세포 엑소좀에 집중을 하고 있습니다. 엑소코바이오 개발한 엑소좀 제품은 근본적인 피부 노화, 학령, 재생 등을 동시에 효과적으로 할 수 있는 새로운 기술입니다. 엑소좀은 크기가 100나노미터 정도 되는 아주 작은 사이즈 베지클입니다. 사람들 간의 교신을 할 때 모바일 폰이나 그 안에 있는 채팅 앱을 이용하는데 중요한 정보들을 담아서 보내는 것이죠. 근데 우리 몸 안에 있는 세포들끼리 그런 정보를 담아서 보낼 때 엑소좀을 이용하는 것입니다. 그 줄기세포 엑소좀 기술이 미래에 가장 유망한 재생의료 내지 재생의학 기술이 될 거라고 생각을 했습니다. 그래서 이 분야의 그 기술을 사업화하기 위해서 엑소코바이오를 설립하게 됐습니다.
The idea or the concept behind exosomes is that we're sending a cell signal and we don't need the cell at all. We just really need the message. My name is Diane Duncan. I'm a board-certified plastic surgeon. I own Plastic Surgical Associates here in Fort Collins, Colorado. Exosomes are not alive. So I would think the basic explanation of how an exosome works would be that it sends out a signal to a regional or neighboring cell, and it tells that other cell or system to do something. What it usually tells the cell in the areas that we work with in the aesthetic industry is for healing of skin and for stimulation of structures that live within the skin or the dermis, such as growth of new blood vessels, growth or stimulation of collagen formation. So I think there's a really giant variety of things, and I think we're really only scratching the surface of what exosomes can do. How exactly exosomes work, I think they're still a little mysterious to us. An exosome is going to give a cell a message depending on the proteins, the message that the RNA has. All exosomes are not the same. They're different depending on their source of origin. But they will tell the cell to do something. The potential of these cells is really what has me interested in them, because if you can target them, say, for certain types of skin cancers or neurologic cancers, even kidney cancers, if you target exosomes to give your T cells, which are immunologic cells, you can induce a cytotoxic response in a tumor cell to make it give itself the message to kill itself. Now, most of the cultured exosomes are derived from conditioned media. And one of the problems with conditioned media, though, is that some of those contaminants are still in the product.
대부분의 그 엑소좀을 분리정제하는 기술은 초고속 원심 분리라는 아주 전통적인 방식입니다. 근데 그 방식은 엑소좀이 분리 과정에서 깨지는 현상이 있었습니다. 이런 점을 저희가 특별히 주목하고 지난 4년 동안 엑소좀을 대량 생산할 수 있는 일종의 그 필터링 기술을 개발을 해서 엑소좀 하나하나의 그 품질을 유지할 수 있는 데 성공을 했습니다. 엑소코 바이오가 개발한 그 순수한 엑소좀을 가지고 향후에는 재생 의료나 항암제 분야로 뛰어들 것을 목표로 하고 있습니다. 엑소코 바이오의 비전은 글로벌 엑소좀 바이오텍 기업이 되는 것이고, 엑소코 바이오가 향후 5년간 1,000억 원 정도의 임상이나 신약 개발에 투자를 하려고 하고 있습니다. 그 결과가 성공적이 되면 전 세계 난치성 질환 환자들에게 큰 도움이 될 걸로 예상하고 있습니다.
Now we've realized that we don't actually have to take the cells, we can actually take the exosomes which carry the message, and that's really delivering this regenerative capacity that is so wonderful that we're seeing.
So what we found was that this exosome treatment was far better and much more efficient than any other treatment that we've tried before.
and the ASC had such a big improvement in her rosacea and overall in her quality of life. It just rejuvenates the skin so well, better than anything else on the market at the moment.
I even recently had a patient who is in her 70s. She had had unremitting shingles with open sores for 3 months. I gave her some Exosome balm and they were all healed up in a week. And she had no more pain.
Exosome is probably the only exosome company that has built a GMP facility for the purpose of manufacture their own product.
So that is really developing the next generation of exocobio, exosome-based medicines for more severe diseases.
Exosome was built to help people stay younger and healthy. Exosome is the global exosome leader, providing hope and a mean for your future.
Exosome, our exosomes, your future.
저나 다른 분들이 노화되는 과정에서 많은 질병에 걸리고 삶의 질이 떨어지는 것을 확인할 수 있었습니다. 저는 조병성이라고 합니다. 엑소코바이오 설립자이며 대표이사를 맡고 있습니다. 엑소코바이오는 줄기세포 엑소좀에 집중을 하고 있습니다. 엑소코바이오 개발한 엑소좀 제품은 근본적인 피부노, 항염, 재생 등을 동시에 효과적으로 할 수 있는 새로운 기술입니다. 엑소좀은 크기가 100나노미터 정도 되는 아주 작은 사이즈의 베제크입니다. 사람들 간의 교신을 할 때 모바일 폰이나 그 안에 있는 채팅 앱을 이용하는데 중요한 정보들을 담아서 보내는 것이죠. 근데 우리 몸 안에 있는 세포들끼리 그런 정보를 담아서 보낼 때 엑소좀을 이용하는 것입니다. 그 줄기세포 엑소좀 기술이 미래에 가장 유망한 재생의료, 재생의학 기술이 될 거라고 생각을 했습니다. 그래서 이 분야의 그 기술을 사업화하기 위해서 엑소바이오를 설립하게 됐습니다.
The idea or the concept behind exosomes is that we're sending a cell signal and we don't need the cell at all. We just really need the message. My name is Diane Duncan. I'm a board certified plastic surgeon. I own Plastic Surgical Associates here in Fort Collins, Colorado. Exosomes are not alive. So I would think the basic explanation of how an exosome works would be that it sends out a signal to a regional or neighboring cell, and it tells that other cell or system to do something. What it usually tells the cell in the areas that we work with in the aesthetic industry is for healing of skin and for stimulation of structures that live within the skin or the dermis, such as growth of new blood vessels, growth or stimulation of collagen formation. So I think there's
We're gonna start
a
again.
really giant variety of things, and I think we're really scratching.
Hello everyone, so we're about to start again. Please get slowly in your seats. So the coffee is outside, so if you want to have coffee, you can quietly go outside, drink some coffee. But we're gonna start in a few minutes again. Yes, I know, I'm sorry.
Thank you.
Very nice, thank you. Actually, maybe you can share it. Oh, sorry, choosing you.
One of the problems with conditioned media, though, is that some of those contaminants are still in the product.
대부분의 그 엑소점을 분리정제하는 기술은 초고속 원심 분리라는 아주 전통적인 방식입니다. 근데 그 방식은 엑소점이 분리 과정에서 깨지는 현상이 있었습니다. 이런 점을 저희가 특별히 주목하고 지난 4년 동안 엑소점을
So we want to ask everyone to please come back to your seats. We're about to start the third session of the night, so please come back to your seats.
성공을 했습니다.
There's another one there.